Good evening, my dear doctors. Will you able to listen me? Please answer in the chat box. Yeah, fine. I can see the other end of the screen. I think so. We are live. Yeah. Good evening, my dear doctors. This is Dr. Sasi for Protion, and this is the session of image-based questions. And this session it's of two parts. Today is the part 1, and tomorrow is the part 2. Fine. With this session means let's understand what does this session addresses. This session address most probable questions or most probable image-based questions to be asked in your FMGE exams. Fine. These questions will be crisp and clear. So, like most probably, what questions will come, that only we'll discuss. Fine. And we always will be crisp with our discussions. Fine. Whatever you will answer, like we'll address in the chat box. And if you have any questions, we'll take up your questions or your queries at the end of the lecture. Fine. This is our motto. And fine. And this session is scheduled for up to 5 hours to 5 hours 30 minutes. Fine. In this session, we complete around 6 subjects in this 5 hours. Fine. This is our motto of a session. If you have any questions, you can connect with us. And I think so everything is clear. And before starting, happy Doctors Day to all of the doctors. Fine. Will you able to clear me? Means will you able to listen clearly? If you have any questions, type in the comment box. Answers means I'm waiting for your answers. Could you please reply me in the comment section? If you yeah, fine. Yeah, I think so. It's clear. Fine. Then, without wasting time, we'll start our first discussion. You see, our first part, it's the anatomy one. Like, it's the anatomy one. Means anatomy, we know, like, you are trying to cram up a lot of things. But just remember, means in anatomy, they always ask new questions. And with this, they follow a pattern. Like, mostly, like, most of this cross-section, yeah. In this, we'll cover anatomy, biochemistry, pathology, microbiology. Like I'll just write for your thing. It will be anatomy, biochemistry, pathology, microbiology. Then we'll address some pedia, PSM, and anesthesia. These are the subjects which we are going to address today. Fine. Yeah. You keep on writing. Like I'll be replying to your chats. I'll be seeing your chats constantly. Fine. We'll start with the first image. If you see, means in recent years, this cross-sectional anatomy of the brain is being repeatedly tested. And means in this cross-sectional anatomy also, they are asking just few questions which you need to must know. Means it's not need to know, it's must to know. Fine. And if you see this thing, if you see this nucleus, could you please answer me in the comment section? What is the name of this nucleus? It is what? It is known as the caudate nucleus. It is known as this caudate nucleus. Fine. And next thing, you need to differentiate the next one. Means if you see this image, means if you see these fingers, it's like a L shape. So if you address the same thing here, this L-shaped one, before this L-shaped one, it is actually what? It is the lentiform nucleus. It is the lentiform nucleus. Fine. This lentiform nucleus, it consisting of two parts. One is the globus pallidus. Next one is the foramen. Fine. It is the globus pallidus and the putamen. If you see this lens-shaped one, this is the outer one. It is the putamen, whereas the inner one it is the globus pallidus. Fine. And to know whether it is this lenticulate nucleus or not, you just remember this L shape. And this L shape, this anterior one, it is this anterior limb of the capsule. Whereas this one, this is the posterior limb. Just remember these 2 points. This is how this anterior limb of capsule looks like, and this is how the posterior limb of capsule looks like. And if you see this adjacent to the third ventricle, you will be able to appreciate this thalamus. Remember, the third ventricle, the adjacent structure, it is the thalamus one. Fine? Yeah, you are getting it correct. Just keep answering. Just be as like more productive. Just be as in the live. If you have any questions, just keep it aside. Okay, we'll address in the last of the session. Fine. Next, if you see this next image, sometimes they will ask this sagittal section. In sagittal section, mostly they will ask these structures. This is what our corpus callosum. Corpus callosum. And this corpus callosum, it has 3 parts. If you see the anterior most, it is the anterior one, it is the genu of corpus callosum. What is the middle one? The middle one, what you are seeing, it is the body of corpus callosum. And if you see the posterior one, it is the splenium. Just remember the posterior one, it is the splenium of corpus callosum. It is the splenium of this corpus callosum. Next one means sometimes they will test you with simple ones, like for example, this structure, which is what our cerebellum. Fine. And if you see a belly kind of thing, a belly kind of structure in the sagittal section of brain, which structure you will think of? Answer in the comment section. Yeah, you are getting it correct. If you see a belly like a structure, it is what? It is the pons. And if you see the next structure which is related to the pons, it is what? It is our medulla. Okay, it is our medulla. Just remember these things, like these are the most commonly images which are being tested. Fine. Then there is a more probability they can test you with this image. And if you see the type of ventricles, fine. First try to identify whether it is CT image or an MRI image. We know in a MRI image, the bones will be black. The bones will be black. If you see this here, the bone, it is flat, black. Fine. And if you see the CSF fluids, if they are also black, it will means it is the T1 weighted MRI. It means it is the T1 weighted MRI one. Fine. Next one. If you see about this ventricular system, we know this CSF, it will be formed from the choroid plexus of this lateral ventricles. Yeah, you are getting it correct. It will be formed from the choroid plexus of this lateral ventricles. Next, from this lateral ventricles, it move on to the third ventricle by a foramen known as foramen of Monro. Fine. It will move to the third ventricle by this foramen known as foramen of Monro. And after moving into the third ventricle, it moves from this third ventricle to this duct known as aqueduct of Sylvius. And after moving from third ventricle to the fourth ventricle, means it will be get connected to the central canal of the spinal cord with 2 foramen. Could you please name these 2 foramen? What are these two foramens? Yeah, there are 2 foramens. The medial one, it is known as just remember the medial one, it starts with the word M. So it is the foramen of Magendie. And the lateral one, it is what? L for L, remember, it is the foramen of Luschka. It is the foramen of Luschka. Just remember these 2 points about this ventricular system. After knowing about this ventricular system, we'll move on to the structure. Could you please name this structure? What is this thing? Means what is this structure is present in the brain? What we call it as? Yeah, we call it as circle of Willis. We call it as circle of Willis. Just remember in the circle of Willis, if you see the circle of Willis, it will be formed by this bifurcation of this internal carotid artery, and it will continue as middle cerebral artery to the anterior cerebral artery. And just remember, if you want to remember only one point about this circle of Willis, just remember, middle cerebral artery means if you see the circle is made by these arteries, not the other arteries. So this middle cerebral artery, it won't get involved in the circle of Willis. Fine. So middle cerebral artery is not a part of circle of Willis. Fine. Whereas the which arteries forms, they are this anterior cerebral artery, then anterior communicating artery. Between these two anterior cerebral artery, you can see this ACOM, which is this anterior communicating artery, and this is how this posterior cerebral artery and the posterior communicating artery looks like. Fine. And these are the structures, and also our ICA forms this circle of Willis, whereas this middle cerebral artery, it won't get involved in the circle of Willis formation. And to highlight the structures, just remember, this is our basilar artery, and on CT cross section, this basilar artery is used to identify the points. It used to identify the points. Just remember. Next one, these are the small pontine arteries, and this is how our vertebral arteries looks like. If you please answer in the comment section, through which foramina this vertebral artery travels. Other than the PDF will be shared in the groups. Okay, the PDF will be shared in the Dr. Banaprakash group, so you don't worry about the PDF. Just focus on the session. Fine. This vertebral artery, if you know, it will travel to these two foramina, but the foramina you need to remember, it is the foramen transversum foramina, which is present in this cervical vertebra. Present in the which vertebra? Cervical vertebra. Fine. Just remember this one. And this vertebral artery will form this basilar artery, and also the posterior means this anterior inferior cerebral artery and the posterior inferior cerebral artery. Just remember these two arteries, that will be enough. Fine. With the same motive, we'll just move on to our thorax part and the abdomen part. Means in thorax and abdomen part, recently they are asking about the cross section. In the cross sectional anatomy, you just remember just few points. For example, the structure which will be adjacent to the vertebra, it is what? It is the descending aorta. It is what? It is the descending aorta. And if you see this structure, which is a large structure, which is in front of this pulmonary artery. Okay, before this pulmonary artery bifurcation, if you see this large structure, it is what? It is the ascending artery. Fine, ascending artery. And if you see some kind of collapse structure in front of this one, it is what? It is the esophagus. It is the esophagus, because we know esophagus contains muscles and it will be collapsed in nature. Just you remember about these few points about this transverse section at the thoracic level. Fine. With this understanding, we'll move on to our next level. And from this image, what they will ask is, they will mention this chamber and they will ask which chamber it is. We know the most anterior chamber of heart, it is which chamber? It is the right ventricle. Could you please address me which is the most posterior chamber of heart in the comment section? Waiting for answers. If you're not in live, just press this live option. You will be having some latency of 10 to 15 seconds. If you are just a bit late, just try to press this live option. Fine. Just remember, the posterior most structure of the heart, it is the left atrium. It is the left atrium. And we know the largest one, it is the left ventricle. And as this posterior most structure, it is the left atrium. When there is an enlargement of this left atrium, this can result in compression of this esophagus. This can result in compression of this esophagus and can cause dysphagia. So just remember this thing about this left atrium. Fine. And as we told, the structure which is adjacent to the vertebra on the left side, it is the aorta. Whereas this one, it is our vena cava. It is our inferior vena cava. Fine. And this is the collapsed one, as I told before, it is what? It is the esophagus. It is the esophagus. Just remember these points. With this, we'll move on to our next slide. Fine. Sometimes they will ask you these questions like, where will you insert the needle for thoracocentesis? We know thoracocentesis means we'll put a needle and we'll aspirate the fluids, or like mainly the pleural effusion fluids, and we'll use it for both diagnostic and therapeutic purpose. But for that, we need to know where we need to administer the needle. So just remember, we need to always administer the upper border of the lower rib. Just remember, we need to administer at the upper border of the lower rib. Means upper border of lower rib. Why we are administering here? It is because if you see the lower border, you'll be able to appreciate this neurovascular bundle structures. For example, there is a vein, there is a artery, there is also the nerve. So if there is any damage to this structure occurs, there might be results in the excessive bleeding, and this can result in a massive trauma to the patient. So to prevent this thing, what we are doing means we are inserting the needle at the upper border of the ribs. Means upper border of the lower rib. Yeah, you are getting it correct. That's awesome. Fine. With the same understanding, this thing which was asked in the last exam. Fine. What they asked is that the constrictions of this esophagus. If you see about these constrictions of this esophagus, the first constriction is at this pharyngoesophageal junction, which is by this muscle known as cricopharynx. Fine. Next, it will be at the level of arch of aorta. It will be at the level of arch of aorta. And next, just remember, it will be having a constriction by this left primary bronchus. By this left principal bronchus or this left primary bronchus. Fine. Next one, while entering the diaphragm, it also has a constriction. Fine. Just remember. And they can give you this same barium swallow image, and they can ask you, like, which means this indentation is due to which structure. We know first from above, it's esophagus. Here the cricothyroid muscles, cricopharyngeus muscle is there. But when we are not able to appreciate this one, but we can appreciate the next structure, which is the impression by this aorta. Fine, impression by the aorta. Next one, if you're able to see, we told the next impression, it will be by the left main bronchus or this left principal bronchus. Fine. These are the two constrictions. And as we learned before, this left atrial enlargement can result in the construction of this esophagus. If it constricts the esophagus, and it can produce some indentation over there, and it can result in dysphagia. So remember, the next constriction, it can happen because of this left atrium. And don't confuse it with diaphragm, because once it enters the diaphragm, it will make a huge indentation. So we will able to appreciate the maximum difference. Okay, so don't confuse the last one with the diaphragm one. Last one, it's because of this left atrial indentation. Fine. With this understanding, we'll move on to our next part. If you see this image, this is how a diaphragm looks like. And this diaphragm, it will be having, like, there are many openings. There are three principal openings you need to remember of. You know this mnemonic, which is known as this Voice of America. Voice of America. But try to identify in this cadaveric specimen. Why I'm telling was because most of the times we be able to remember this mnemonic, but in image-based questions, you are not able to understand which one is the vena cava opening, which one is the esophageal opening, and which one is the aortic opening. Just remember, this is the central tendon opening. Vena cava opening, it will be at the central tendon. Means you can able to appreciate this tendon. So this central tendon opening will be this vena cava opening, and this will be at the level of, this will be at which level? Could you please answer in the comment section? Just remember, it will be at the level of T8 vertebra. Fine, it will be at the level of T8 vertebra. Fine, it will be at the level of T8 vertebra. And next one is the esophagus. Just remember, next one, this esophagus, it will be at the level of T10. Next one, this aortic opening, it will be at the level of T12. Okay, 8, 10, and T12. And next, if you know this opening, they can ask you the true or false statement, like which structure passes through this structure. Fine, we know it's a vena cava opening. So obviously, here the vena cava will pass. So you need to remember the other structures. The other structure, you need to remember, it is this rib. You can remember as rib, R-I-P. Okay, which is this right phrenic nerve, and next this one, which is this IVC. Fine, just remember, it is, remember as rib, which is right phrenic nerve on the IVC. Next one, if you see this esophagus one, yeah, you are getting it correct. If you see this esophagus one, you just remember two more structures. Esophagus, so the nerve which is being passing here, it is the vagus. Esophagus which will be passing through this esophagus. Fine. Next one, the artery passes here. It is the left gastric artery. Left gastric artery. Fine. In a case of aortic opening, there will be passing of this aorta along with this thoracic duct. Thoracic duct. Okay. Fine. It will be passing along with this thoracic duct. Just remember, thoracic duct passes through this aortic opening. Just remember this. Fine. With this understanding, we'll move on to our next part. If you see this next part, sometimes they can give this abdominal image and they can ask you, like, this is the structure. If you see the presence of gas and is at the anterior portion of this abdomen. So it is what? It is the stomach. And which is the organ which forms the bed of the stomach? Means like which is the one of the organ which forms bed of the stomach and lies on the left side? Yeah, just remember the organ which is present on the left side and it's forming the bed of the stomach. It is the spleen. It is the spleen one. And we know adjacent to the vertebra, the structure which passes, it is the aorta. Especially here, it is the descending aorta. Means this when it crosses this diaphragmatic opening, it results in the abdominal aorta. Just remember this one. And next structure here, it is the inferior vena cava. And you can see this greenish color. This one, it is the gallbladder. There are some extension of this liver also you can see. So just try to appreciate it. Just to try to appreciate your anatomical knowledge in an image. Fine. And we know these are these two kidneys. These are these two kidneys, right one and this left kidneys. Okay, these are the two kidneys. And other than this, don't cram up multiple data and forget. Just remember these few data because they might be means these are the higher chances to be asked. Fine. With this image, we'll move on to the next part. In recent exams, they are also asking this level of vertebra. So, means last FMGE exam, they have given this vertebral level around here. So just remember, from the clavicle, just if you're not able to identify, just palpate yourself. If you see at the level of clavicle where it is joining, it is between this T2, it is a disc. Remember, it is the disc between this T2 and the T3 vertebra. Fine. And next, if you see the next one, if you see around this is how this first rib, second rib. Around the second rib, if you're able to see, it is the T4 to T5 disc level. Okay, fine. If it is T2 to T3, next one, it will be the T4 to T5. Just remember. Because they will skip this one because this first rib is already means getting joined here. Fine. Next one, you have to remember the level which is at this level, which is not known as what, which is known as this subphrenic, means our subcostal plane, which is known as what? Subcostal plane. Just remember this subcostal plane will be around this L3 or between these discs of L3 to L4. Fine, L3 to L4. And if you see this next plane, if you see this tubercular plane, means it will be passing between these two tubercles. So this tubercular plane, it will be around the L5, tubercular plane. Just remember. And these are the things you need to remember about few vertebral levels. And if they mark you some vertebral level, and if they are asking you corresponding arteries responsible, just remember superior mesenteric artery, it will be at the level of L1. Fine. Inferior mesenteric artery, it will be at the level of L3. Superior mesenteric artery, it will be around the level of L1, whereas this inferior mesenteric artery, it will be at the level of L4. We know at the level of between L4 means between L4 and L5, this aorta will get bifurcated. Fine. There are few means like anatomy will be just most kind of cramming up of things. So don't get tricked, just become. Fine. If you see the next image, what is this appearance known as? Could you please answer in the comment section? I'm not able to see few of your answers. Just answer and start answering in the comment section. Just remember this appearance is known as winging of scapula. This winging of scapula, it's due to damage to the which nerve? It is due to damage to this long thoracic nerve or this nerve of Bell. Okay, or this nerve of Bell. This results in this winging of scapula, and most we know the one of the risk factor for this, it is this mastectomy surgery. Fine. And if you see this image, this is how this Erb's palsy looks like. This is how this Erb's palsy looks like. We know in case of Erb's palsy, the trunk which is being damaged here, it is the upper trunk. It is the upper trunk which is especially from the level of C5 to C6. And we know this deformity, which is known as this. Yeah, you are getting it correct. We know this deformity known as polystrip deformity, which is seen in a case of Erb's palsy. And in this, there will be a adduction. There will be adduction, and that means just remember there will be adduction, and then there will be internal rotation. And on back side, you'll be able to see this flexion over the hands. Just remember it is the adduction, internal rotation, and the flexion. Okay, this is which is also known as this policeman tip deformity. Fine, just remember this one. Next one, if you're able to see the difference in the counter over this deltoid region and this anesthesia over this region, anesthesia over this region, which is known as this regimental anesthesia or this regimental sign. Both of these things, they are seen in a case of axillary nerve injury. Both of these things, they are seen in a case of axillary nerve injury. Just remember these 2 points, it will be enough for you. You know, this axillary nerve, it will supply 2 muscles, which is this deltoid one, and next one, it is this, the minor muscle. Fine. Just remember these 2 things. This axillary nerve, it will supply this deltoid. So if there is any damage to this nerve supply, there will be no counter to it. Fine. Yeah. And what is this? Means, could you please answer me which nerve damage can lead to this condition? Yeah, this is what? This is the wrist drop. This is the wrist drop. Yeah, you are getting it correct. This is known as what? This is known as this wrist drop, which happens because of this radial nerve damage. We know the most common site of this radial nerve damage is due to the shaft of humerus fracture. Shaft of humerus fracture. Just remember this points, which is this radial nerve. Fine. We'll study about this femur images in the orthopedic one. Fine. Next one. This partial claw hand, or sometimes this complete claw hand also. And this test. Could you please answer me? What is this name of this test? 25 answers. Yeah, guys, you are getting it correct. It is known as what? It is known as Fromet sign. Fromet sign. We know this, both of these things, they are seen in a case of ulnar nerve damage. You know, this ulnar nerve, it supplies this adductor muscles. And if there is any damage to this muscle, the patient unable to hold this paper or the book test. Fine. If he is unable to hold this, so he will use his flexors and he will try to grab it. Fine. So this is known as what? Fromet sign. This is known as what? This is known as Fromet sign. And if you see, while making this fist, if he is having this sign, which is known as this Benedict sign, along with this test, means like for this nerve damage, we can do this test known as this pen test, because the nerve which is responsible are this abductor pollicis muscle, which will be supplied by this muscle, this nerve, and you can see this one more sign known as pointing index. Pointing index. And all of this, it will be suggestive of which nerve damage? It will suggest you of this median nerve damage. It will be suggestive of this median nerve damage. And we know the median nerve, it can also be entrapped in some conditions like carpal tunnel syndrome. Carpal tunnel syndrome. Fine. These are the few images you need to remember. And just remember this ulnar nerve can be entrapped in this Guyon's canal. And this entrapment can lead to this ulnar nerve damage. Fine. With this understanding, we'll move on to few images. If you see this, you will get confusion about few tarsals, because they stopped asking about this carpals. Now they started asking, like previously they started asking about this tarsals. Okay, tarsals. In these tarsals, if you see 1, 2, 3, there are these 3 cuneiforms. They are these 3 cuneiforms. This 1, 2, 3. They are these cuneiforms. And fourth one, it is the cuboid. It is the cuboid. And fifth one, what is the fifth one? Could you please answer in the comment section? Yeah, guys, you are getting it correct. It is known as what? It is known as this navicular. And sixth one, it is our calcaneum and seventh one it is the talus. Seventh one it is the talus. And sometimes they will show this reflex and they will ask you what is the nerve root for it. In a case of ankles reflex, in the case of ankle reflex, just remember, just try to grow 1, 2, 3, 4 from below. So it is 1, 2, next one at the level of 3, knee it is 3, 4, next one at initially at flexus it is 5, 6, and if you see this extensor it is the 7, 8. So ankle reflex, we'll see this S1 and S2 involvement means the nerve roots responsible for this ankle reflex, it is the S1 and S2. Whereas for this knee reflex or this knee jerk to happen, it is because of this L3 and L4. Fine. And this biceps, remember biceps means it's a yearly word. B, T. So B, it comes in first in alphabet. So remember B, biceps reflex, it will be C5 and C6, whereas this triceps one, it will be C7 and C8. Just remember this few points about this reflex. Fine. Yeah. I think so. You don't have any questions. If you have any questions, just keep it with you. We'll address it in the first session. Fine. And next, with this understanding, we'll move on to few parts of biochemistry. In biochemistry, there are few questions. It will be asked based on images. In a case of glycogen storage disease, if you see this glycogen storage disease, we know this glycogen storage disease, the most common one, it is this von Gerke disease. It is known as what? It is known as this von Gerke disease. Fine. And this G for G, this remember this G for G, it will be due to the deficiency of glucose 6-phosphatase. It is due to the deficiency of glucose 6-phosphatase. And in the case of glycogen storage disease, we know we need glycogen for our energy and metabolism. So after a while, if there is no glycogen, the liver need to go for the gluconeogenesis. And if the liver works hard, and we know like kidney also can involve in gluconeogenesis. So if both of these organs or few organs start involving into this manner, this can result in this hepatomegaly or this organomegaly because they are working more than the usual. So you will be able to see this appearance of hepatomegaly along with features of hypoglycemia. So if they are not having enough glucose, we know they couldn't grow well. So they will be having these features of failure to thrive. Okay, they will be having these features of failure to thrive. And because they couldn't generate from this glycogen, so they will be generated from some other sources, like for example, ketone body synthesis or gluconeogenesis. So there will be increased production of this ketone bodies. So these are these things which will be mentioned in the question. So we just try to address with these things. Next one, how to remember these mnemonics about these enzymes. Just remember Pompe. Pompe means type 2. It is what? It is this lysosomal enzyme defect. And remember this, there is a O. So this only glycogen storage disease is having some indications are associated with some heart condition. It is this Pompe's disease. So remember, convert this O into heart one. Next, remember this C for D. CD, AB, MM, and HH. Fine. This Cori disease, it is due to absence of this debranching enzyme. So if there is no debranching enzyme, the glucogen will stay like that. So it cannot be broken down. And if there is no branching enzyme, the glucogen cannot be branched. So it cannot be stored for a long time. Fine. Next one, this Mercadiless disease. Mercadiless disease, it is due to this M for M, it is due to this presence of this muscle glycogen phosphorylase. And H, remember hers, it's because of this hepatic glycogen phosphorylase. It's because of this hepatic glycogen phosphorylase. Just remember these few points about this glycogen storage disease. Next one, if you see this appearance, there is a history of this and long-standing of this urine is converting into this black color. So this typical history along with this discolorations over this pinna and tip of the nose. What is this name of this discoloration? What is the medical term you will use for these discolorations? Answer in the comment section. Just remember guys, the medical term for this, it is known as ochronosis. Ochronosis means on the tip there will be discoloration because of this accumulation of this pigment, and sometimes it can accumulate near to the lips even. Fine, you just remember. And this can deposit into the intervertebral discs and joints also. Fine, this is how this ochronosis looks like, and it is seen in a case of alkaptonuria. And we know the enzyme which is being deficient in a case of alkaptonuria, it is what? It is the homogeneous oxidase. Just remember these things about this alkaptonuria. Fine. Next one. If you see this is a child who is presenting with the features of mental retardation, and sometimes they will be having this blonde hairs or this golden yellow hairs. This blonde hairs, they will be seen in a case of phenylketonuria. Phenylketonuria. And we know this phenylketonuria, we can do a test in few other conditions. So we can use this test. This test, it is known as what? It is known as this ferric chloride test. It is known as this ferric chloride test. Just remember these things. And this phenylketonuria, it's due to the absence of phenylalanine hydroxylase. Phenylalanine hydroxylase. Yeah, just remember these things. Next one. If you see this girl, because of this absence of this pigment, this girl is suffering from this albinism. And in albinism, the enzyme which is being deficient, it is this deficiency of this tyrosinase enzyme. Just remember the single points in a biochemical perspective of this. Fine. And in a case of enzymes, they will give this enzyme and they will ask you, is this a competitive incubation or a non-competitive incubation? Just remember, in a case of competitive incubation, it will cross. Competitive incubation, it will cross. Fine, remember. We know, if you draw this plot, this is how this Km looks like. Minus 1 by Km looks like. And this is where this velocity, which is 1 by V. And where there is a maximum velocity is known as Vmax. And since we are taking it in a reciprocal manner, we'll call it as 1 by Vmax. Just remember, in a case of competition, if there is some competition between some people, fine, they will run with the same velocity, but the difference will be the kilometer of their running. So the difference will be the kilometer in their running. So here the Km will be increased. The Km will be increased, whereas this velocity remains unchanged. The velocity will remain unchanged in a case of competitive. So if you draw these graphs, since this velocity is unchanged, it will cross here, whereas this Km, it will be changing, so it will be shifted here. So the crossing will happen in a case of competitive incubation. Okay. In a case of non-competitive incubation, just remember, since here the Vmax is unaffected, then opposite of this here, the Km will be unaffected. Whereas since there is no competitions, if there is no competition, your potential means, if you just remember, if there is no competition for anything, your potential or your insight towards it, it will start decreasing. And your motivation towards it will start decreasing. So your velocity will be decreased. So in the case of non-competitive incubation, your Km, the kilometer will remain same, whereas you will start running very slowly. Just remember these things about these enzymes. Fine. With this understanding, we'll move on to few deficiency of this vitamins. Fine. If you're able to appreciate it, is how this spot known as Bitot spot looks like. This Bitot spot, it happens in a case of vitamin A deficiency. Just remember, in a child, will start supplementing this vitamin A will means in a normal schedule as from this 9 months. From 9 months, we'll start delivering this vitamin A to the child. Just remember these points about this vitamin A. And if there is a Bitot spots, there is a classification. It will comes under this X1B. B for Bitot spots. And this rosary shaped lesions in the ribs, they are seen in a case of rickets. So they are known as ricketic rosary. Fine. We'll study more about these rickets in our pediatric discussion. Upcoming today we'll discuss. Fine. Next one. If you see this, there is a features of glossitis, chiliosis, and sometimes is itching and burning sensation. These they are seen in a case of vitamin B2 deficiency. Vitamin B2 deficiency. Fine. Just remember, in the case of vitamin B1 deficiency, could you please answer me in the comment section? What is the other name of vitamin B1? Just remember, the other name of vitamin B1, it is the thiamine. Okay. This vitamin B1, it can be measured. Means it can be deficient in a case of alcoholics. Fine. It can be deficient in a case of alcoholics, and this can also result in a condition known as beriberi. And this can be of two types. One is known as wet beriberi. Next one is known as this dry beriberi. Just remember, this wet beriberi, you know heart contains blood, so blood is wet. So this wet beriberi, it will involve this heart, whereas this dry beriberi, it will involve this neurological or this CNS involvement. Just remember. And to estimate this vitamin B1 level, we'll use a enzyme. We'll use an enzyme known as transcatalase. RBC transcatalase. Just remember. We'll use an enzyme known as RBC transcatalase. Fine. Just remember. Next one. This type of rash you will see in the case of vitamin B3 or the niacin deficiency. Niacin deficiency. Fine. This we know this niacin can be tryptophan, and this tryptophan deficiency can also present with this niacin like of features like photosensitive rash. And you just remember these few points about this thing. And for example, in a constant mazitis, we know the mazes will be having this limited in this tryptophan, so they will be having this deficiency of this tryptophan, so they will be having this typical features of it. And if you see this next image, you'll be able to see this appearance known as eye of tiger appearance. Eye of tiger appearance. You will see in the case of which disease? Answer in the comment section. Just remember this eye of tiger appearance. It is known as this Haloverden spot sign. It is known as what? Haloverden spot sign, and it is due to this pantothenate kinase deficiency. It is due to this pantothenate kinase deficiency. Just remember. Okay, fine. It is due to the deficiency of pantothenate kinase deficiency. Just remember. Okay, fine. Yeah, I think so. Everything clear. There is no any questions in the chat box. If you have any questions, just keep it aside. Fine. Next, if you see this accumulation of this copper in the eyes, what is the name of the ring? You will call it as? Answer in the comment section. Yeah, you will call it as KF rings. You will call it as KF rings. And this excess accumulation of this copper, it is seen in a case of Wilson's disease. Fine. And this Wilson's disease, it is due to the mutation in the ATP7B gene. Fine, ATP7B gene. Whereas if there is any mutation in this ATP7A gene, 7A gene can result in this disease. You'll be having this kinky hair. You'll be able to see this kinky hair. This kinky hair due to this ATP7A gene defect, it is known as what? Menkes disease. It is known as Menkes disease. Just remember. Fine. Yeah, you are getting it correct. That's awesome. Yeah, you are up to the mark. Means you are getting it correct. Means if you are in the verge of preparations, it's absolutely enough for you to crack the exam. Fine. So this will move on to the last part of our anatomy and biochemistry one. This, if you see this presence of this crumpled tissue paper appearance, the crumpled tissue paper appearance along with these features of organomegaly, along with this crumpled tissue paper appearance. This, both of them, they are seen in a case of Gaucher's disease. They are seen in a case of which disease? They are seen in a case of Gaucher's disease. This is how this crumpled tissue paper appearance will look like. Fine. Like these are the two things you need to remember about this Gaucher's disease, because they will be having this similar features of organomegaly, like glycogen storage disease, and on blood examinations you will be having this appearance of crumpled tissue paper appearance, and they will be having these conditions of recurrent infections. Whereas to differentiate with this glycogen storage disease, they will be having these features of hypoglycemia. Just remember, and the enzyme which is being responsible for this, it is this due to the deficiency of beta glucosidase. Just remember, it is due to the deficiency of beta glucosidase. Fine. If you have anything, just write in the comment section. With this, we came to an overview about this anatomy and biochemistry, and we'll move on to our further subjects with now. Fine. If you see about the pathological aspect, when there is an injury, when there is a stress, initially the body can overcome by an adaptation process. If not, there will be a reversible cell damage, and if the body cannot cope up, this irreversible damage can result into an irreversible damage and can result into the cell death. Fine, it can result in even cell death. And in the case of irreversible cell injury, if you see this thing, this is how this normal nucleus looks like. Fine, this is how this normal nucleus looks like. But because of this irreversible cell death, there will be activation of this enzyme leading to this clumping of this nucleus known as pycnosis. Once it clump, it cannot, the cell is also died. So they need to break down it, and they need to remove to the outside. So they will do this lysis known as karyolexis. They will do this thing to break them into the small parts known as karyolexis. And once they broke down into the small portions, they need to lyse it so that the new cell can grow or they can accommodate the place. So the next process is known as karyolysis, in which this nuclear material, it will be lysed completely. Fine. And based on the cell death, we know there are different types of cell death. There might be programmed cell death. There might be some cell deaths without any programming. There might be caspase dependent and caspase independent. Sometimes in image-based questions, they will ask this question: which one of the following is this apoptosis one? And which one of the following it is the necrosis one? We know apoptosis, it is a caspase dependent programmed cell death. So in the case of apoptosis, we know the cell knows where it need to go and break the cell. Fine. So it will leads to this pattern known as, because of this proper breaking down of these cells and this DNA molecule will break down in a manner, so it will appear as a step ladder pattern. It will appear as a step ladder pattern on a gel electrophoresis. Fine. Whereas in the case of necrosis, it's not a programmed one. So since it's not a programmed one, so it will go and attack randomly, and it will show this smearing pattern. So remember, this step ladder pattern, it will be shown by this apoptosis, whereas the smearing pattern, it will be shown by this necrosis. Fine. And just remember these two things. Fine. With that, we'll move on to some other type of necrosis, which can be asked in your exam. First thing, if you're able to see this thing, if there is maintenance of this architecture, and if the architecture is maintained, if the architecture is maintained, it is what? It is this coagulative necrosis. And this is how there is a maintenance of this organ architecture and even this necrotic architecture even. So this is how this coagulative necrosis looks like. And the main mechanism for this coagulative necrosis, it is what? It is this protein denaturation. Whereas in the case of liquefactive necrosis, if you're able to see this liquefactive necrosis, it is mainly dependent on enzymes. If it depends on enzymes, then if it depends on these enzymes, it will go and break randomly, and it cannot maintain this architecture. So the architecture will be lost. So the main mechanism by which this thing happens, it's by this enzymatic degeneration, and this is how this liquefactive necrosis looks like. And this liquefactive necrosis can be seen in a case of brains and some infections like abscess formation. Whereas this coagulative necrosis, it will be seen in a case of solid organs. Yeah, I think so. Few of you are not in the live session. Just click this live option, because sometimes what happens is you will be watching this video like 10 to 15 seconds back. So try to be in the rhythm. Fine. And if you see, there is some other type of necrosis in which you'll be able to appreciate the presence of this both liquefactive plus coagulative necrosis. And this necrosis, it will be caseous or like a cheesy one. This cheesy type of necrosis, it is known as what? Caseous necrosis. Okay, it is also known as what? Cheesy necrosis. The cheesy one. And this cheesy will be seen in a case of TB, because of this presence of this mycolic acid in this TB bacilli. Because of this presence of this mycolic acid in the TB bacilli. Just remember these things. Next, if you see this thing, we know the fat necrosis, it's most commonly occurs in the tissues which contains more amount of fat. For example, in the breast tissue or in the gluteal region. Whereas in some places, it can occur where there is less fat. For example, if you think about our mesentery, if there is any conditions like pancreatitis, This pancreatitis can result in the release of these enzymes outside. If this enzyme get released and this go on and coagulate these fats, and they will make these small calcifications over there by a reaction known as saponification reaction. So this type of saponification reaction in omentum is seen in a case of, this is the specimen of a omentum, seen in a case of fat necrosis. Just remember these few points about this thing. Next one, if we move on, we'll be able to see this kind of deposition into the vessels. And how we are telling it's a vessel, you can see there is a red, means it's not that much clear, but you will be able to appreciate this red color RBC cells inside it. So this presence of this RBC and this presence of this fibrin deposition is seen in a case of fibrinoid necrosis. And remember this fibrinoid necrosis, they are most commonly seen in some 3-letter words like rheumatic heart disease and polyarthritis. This is a typical case of polyarthritis nodosa. We know in a case of polyarthritis nodosa, the blood vessels will be getting involved and it leads to this fibrous necrosis. Fine, it leads to this fibrous necrosis. So it is seen in a case of RHD and PAN. Fine, and in a case of some kind of malignant hypertension also, we'll be able to appreciate this fibrinoid necrosis. Next one is to differentiate between this dry gangrene and the wet gangrene. Fine, to differentiate this, there is just only one mark. There will be a line of demarcation between this healthy tissue and the gangrenous tissue will be seen in a case of dry gangrene. But in the case of wet gangrene, you will not be able to appreciate a proper demarcation. This is how you will be able to differentiate this dry gangrene from the wet gangrene. Just remember these 2 points so that you will be able to differentiate this necrosis and the gangrenes. Fine. With this understanding, we'll move on to our next part. We told if the cell is not able to adapt, it will die. Whereas if it's like a doctor like us, means it will adapt to the situation and it will react. For example, in the case of esophagus, which is less acidic, if it get exposure to the acids, this squamous epithelium in the esophagus, it will be converted into this pseudostratified columnar epithelium along with this presence of this goblet cells. Okay, along with this presence of this goblet cells. And this transformation, it is known as, this type of metaplasia, it is known as intestinal metaplasia. And to confirm this type of intestinal metaplasia, I told there is a presence of this pseudostratified ciliated columnar epithelium along with this goblet cells. This goblet cells, it will be containing a secretion known as mucin. Okay, this will be containing a secretion known as mucin. So they are known as this acidic mucin. So we can stain this acidic mucin and we can get to know whether this thing is it the intestinal metaplasia or not. So to stain this, we'll use a stain known as Alchian blue. So the stain material will be blue in nature. So you will be able to appreciate the stain material, it is blue in nature. Whereas here this is normal stratified squamous epithelium of this intestine. Here you will be able to see this development of this pseudostratified ciliated columnar along with this presence of this goblet cells. Just remember. And there are few stains you need to remember. If you are fat enough, means sometimes you will gain weight and you want to lose weight. So if you are fat, you need to lose fat. So just remember for LOS or lose fat. So to stain the lipid or fat, we'll use this stain. So to stain this lipid, we'll use this stain known as oil red O. And next one it is known as this Sudan black B. So just remember, in the case of oil red O stain, the stain fat, it will be in which color? Answer in the comment section. Yeah, just remember, it tells it's oil red O. So this fat will be stained as red in color. Whereas the Sudan black B, it will be staining this fat into black. Just remember about this pneumonia. With this understanding, we'll move on to 2 more pigments. If you see a perinuclear pigment, we know where there is a work, there will be the wastage. So if you see this perinuclear pigment, which is getting developed near to the nucleus. So if it is getting near to the nucleus, means we know nucleus does a lot of work. So if it is getting near to the nucleus, means it is known as the wear and tear pigment. It is known as this wear and tear pigment. And this wear and tear pigment, it is actually what it is this lipofuscin. It is what is the lipofuscin. You know, it has this word lipid. So if it is having this word lipid, we can stain with this oil red O or this Sudan black B. Just remember these 2 points. Okay, fine. With this understanding, we'll move on to the next one. If you're able to appreciate, it is also near to some nucleus, but it will be overall pigmentation. And this overall pigmentation, it is known as what? It is the hemosiderin. During any hemorrhages or during any RBC breakdown, this may can develop here. Fine. This hemosiderin, we know it contains heme. So if there is any element which contains of iron, we know we can stain with a thing which is known as what? Which is known as Pearl's Prussian blue. We can stain this iron with the stain known as Pearl's Prussian blue. Just remember these things. But by the way, it is not this Pearl's Prussian blue stain because it's a blue stain. But whereas this is a normal HNE stain. Just remember. Okay, don't get confused. Next one, we'll move on to next other stains like this stains. They are known as our Mason stains. This Mason stains, it's of two varieties. One, we used to see this thing for melanin. So Mason for melanin, it is known as what? This type of Mason we use for melanin, it is known as what? Mason Fontana stain. Mason Fontana stain. And by the way, in a case of wound, if there is an injury, the injury will get resolved by healing. So if there is any healing wound, you need to differentiate this granulation tissue from the smooth muscles. To differentiate this smooth muscle from the granulation tissue, you will use this stain. You will use this stain, which is known as Mason trichrome, which is known as Mason trichrome, which is able to stain this collagen. Which is able to stain this collagen. Just remember this. Fine. With this understanding, we'll move on to our one more stain. If we see, this is the same. If you're able to appreciate some kind of blood vessels, some kind of blood cells, so it is the blood vessel. And if you're able to see some kind of accumulation of this calcium, means accumulation of this calcium, it is known as what? Monkey-Burg medial sclerosis. And this Monkey-Burg medial sclerosis, there will be accumulation of this calcium into the middle wall of the blood vessels. Fine. There will be accumulation of this calcium into the middle walls. So to know this accumulation of the calcium, we'll use a stain known as von Cosa stain. So just remember, to remember this, remember there is a famous slipper brand known as VKC. So this von Cosa stain, it will be used for this calcium. And we know the slippers will be black in color. If you're not able to remember the slippers in black color also, you can remember this Cosa or Kala. Okay, Kala means this calcium will produces this black color. Just remember, it will produces this black color. And if the same calcium, if it's stained with a red stain, so it is known as what? Alizarin red. Yes. So in these cases, you will able to see this red color deposition of this calcium in the case of alizarin redness. Fine. Then we'll move on to some other deposition, some other kind of calcifications. We know there is a dystrophic calcification and there is a metastatic calcification. And this dystrophic calcifications, just remember, dystrophic calcification develops in a dying tissue or a dead tissue. So the calcium level here, it will be normal. Whereas in the case of metastatic calcification, this calcium levels will be increased. Just remember, the calcium levels will be increased. Fine. And this dystrophic calcification, you'll be able to see bodies. Could you please answer me in the comment section? What is the name of the bodies you will see in the case of dystrophic calcification? Answer in the comment section. Waiting for answers. Yeah, just remember, these bodies which are seen in a case of dystrophic calcification, they are known as Samoma bodies. They're actually what? They are dystrophic calcifications. And you can remember this mnemonic as PSM, like papillary carcinoma thyroid. It will show the Samoma bodies, and serous cyst adenoma of ovary, and the meningioma will show you this presence of the Samoma bodies, and the Samoma bodies will be stained with this calcium stain. Fine. With this, we'll move on to the next part, which is this one of these killing methods or this self-defensive methods. They are known as this nets, neutrophil entrapments. This nets, it's actually what it is known as beneficial suicide. Why it is known as beneficial suicide is that at the end of this thing, the neutrophil will get die. The neutrophil will die at the end of this killing mechanism. Fine, the neutrophil will get die. So this is known as beneficial suicide. And you can see this nuclear material which is being sent outside and set as a trap. And the main mechanism which is responsible for this development of this nets is this process known as citrinization. Citrinization. This leads to this formation of the traps. Just remember these things. Fine. With this understanding, we'll move on to some kind of giant cells. Fine. If you see here, if you're able to appreciate, yeah, horseshoe-shaped arrangement. What is the name of the giant cell? You will name it as, will you call it as Langhans cells or Langerhans cells? Just remember, don't confuse. Fine, just don't confuse. If you see here, horseshoe-shaped giant cell, it is what? It is the Langhans giant cells. Whereas this Langhans cells will be seen in a case of TB. If you see this Langer, this Ger will be seen in a case of Der, means derma. So this Langerhans cells will be seen in a case of derma. Fine, dermatology will be able to see this Langerhans cells, whereas this Langhans cells will be seen in a case of TB. Fine, and if you're able to appreciate this giant cells, which contains this both intranuclear and the intracytoplasmic inclusions. This both intranuclear and intracytoplasmic inclusions of this giant cells, along with this arrangement of the width, they are seen in a case of Warthin-Finkeldy giant cells. And this Warthin-Finkeldy giant cells will see in a case of measles. You will see in a case of measles. Just remember. Next, these two cells you will get sometimes confused. So this is how both of them, they looks like a owl appearance. Whereas if you see a red one, red center, it will be seen in a case of red nucleus. It will be seen in a case of red one, or the pink one will be seen in a case of Reed-Sternberg cell. Fine. Whereas this blue one, it's not that much clearly appreciable. This blue one, it will be seen in a case of, this owl will be seen in a case of CMV. It will be seen in a case of CMV virus. Just remember. Next one. Well, if you're able to appreciate this type of multinucleated giant cells, you can see 1, 2, 3, and few more, 4, 5, 6 also. There are many nucleus. So if you're able to appreciate this multinucleated giant cells in a case, in a Zank smear. Zank smear is a smear which is being used in the dermatology. Just remember, if you're able to appreciate this multinuclear giant cells in the Zank smear, it will be suggestive of which infection? It will be suggestive of this HSV infection. Okay. With this understanding, we'll move on to our next part. Fine. Next part is this genetics one. You see this genetics one. You need to means like they will give this graph and you need to identify which type of inheritance is this. Fine. And to identify this type of inheritance, you need to understand two things. One is this gender. Next one is the generations. And just remember, if there is any particular gender bias, yeah, you are getting it correct. If there is any particular gender bias, then it will be the X-linked disease. Whereas if there is no gender bias, it will be either autosomal dominant or the recessive one. So to differentiate this between dominant and recessive one, you need to look on the generations. If there is no skip in generations, then it will be autosomal dominant. Means here if you see both males and females are infected, means there is no gender bias. Next, if you are able to see from first generation and second generation, all of them, they are getting affected. So there is no skip in generations. Whereas next, if you are able to see here, there is no gender bias. Like both of them, they will be getting infected. Fine. But if you're able to see, the one complete generation is empty. So if there is a skip in generation, it will be what? It will be autosomal recessive. And next, to remember this X-linked dominant and recessive one, just remember who is always dominant? The females. The females are always dominant. So the father to all daughters. Just remember, females are dominant. So this X-linked dominant will be seen in a case of females. It will be mostly affected in the females one. Whereas this X-linked recessive one, it will be most commonly seen in a case of males. Because if females are dominant, who will be recessive? Of course, our males community will be recessive. So males will be recessive. Just remember. Fine. You can see this involvement of males. Fine. Here you can see this involvement of father to all daughters. Okay, father to all daughters. This is what XLD and XLR. Next, if you come to this part of genetics, you are able to see two syndromes. One is this Down syndrome. Why it is named as Down syndrome? Because it's trisomy. Which one? It is the trisomy 21. Remember, it's the age of 21. It is 21 years. He's 21 years and he's still single. So he's down. Why he's still single? He's single because Robertsonian. There is a translocation known as Robertsonian. Roberts translocated his girlfriend. So it is known as Robertsonian translocation. So this Down syndrome happens because of this trisomy 21 and this Robertsonian translocation. Just remember this Robertsonian translocation, it will be age independent one. Okay, it will be a age independent one. Fine. So he's a 21 years old, and why he's down? Because he's not having any girlfriend. So he's a single one. So to represent his singleness, what will be having is he'll be having a single simian crease. Remember, so he will be having a single crease known as simian crease. Okay, he'll be having this single simian crease. Fine, simian crease. And if he is single, he couldn't afford a girlfriend. So he no need to wear shoes. So he will wear just as far as he will wear sandals. So he will be having this sandal toe gap. And if he's single for a long time, he used to get heartbroken. So sometimes it means like he will get heartbroken. So he will be having some cardiac defects like endocardial cushion defects. Fine. He'll be having this endocardial cushion defects. Yeah, you are getting it correct. Then if he's having this endocardial cushion defect, then he's broken, means he's having this broken heart, then he will cry because he's single. So he'll be having this slanting of the eyes. He'll be having this slanting and this Mongolian slant of eyes. Just remember these things about this Down syndrome. And just I will add one more point to it. The most common leukemia you will see in a case of Down syndrome, it is the ALL. So since he's single, he puts application to everyone whom he sees. So he will put applications to all. So the most common leukemia, it is this ALL one. Whereas if you ask a more specific one, so the most specific type of leukemia he will be having, it is this AML M7. And if you ask him, yesterday you proposed whom? Since he's putting applications and he's proposing to everyone, he didn't remember to whom he proposed yesterday. So he'll be having a condition known as pre-senile Alzheimer's. So just remember the story, you will be grasped about this syndrome in a much better aspect. Fine. Next one, we'll see about this Turner syndrome. Means the Turner is not same like a Down, because Turner, she's a girl. So as she's a girl, she's getting committed more, means she got committed easily. And she's a short girl. Remember, she's a short girl. So she's having this short stature. Since she's having this short stature, these tall girls in the class, they used to bully her like a like that while she's going or walking. They used to call her so. And because of this calling as so, she'll be having this 45XO. So this 45XO karyotyping will be seen in the case of Turner syndrome. And one day she got anger and she wanted to turn and reply that. But when she was trying to turn, she remembered she's having this Turner syndrome. And this Turner syndrome, she'll be having this low posterior hairline and this webbed neck. So because of this webbed neck, she's not able to turn. So there is a presence of this webbed neck. Next, if you see this thing, and he's, as I told, she's not like Down syndrome. He's having a male variant known as what? Noonan syndrome. And both of them, they are maintaining these streaks. How they are maintaining these streaks? Both of them, they're having this cardiac anomalies. For she will be having this bicuspid aortic wall and this coarctation of aorta. Whereas this Noonan, we know boys are always right. So he will be having this right side. It's a male variant of Turner syndrome. He'll be having this right-sided abnormalities like this pulmonary stenosis. Okay, just remember, he'll be having this pulmonary stenosis. Fine, that's it. That's it about these two syndromes. And if you want to remember about this next syndromes, if you see there is a presence of this polydactyly and everything with P, it means polydactyly, cleft lip, and cleft palate. It will be seen in the case of Patau syndrome. will be seen in a case of Patau syndrome. Fine. Yeah, we know Patau syndrome. It's because of this trisomy 30. Fine. Trisomy 30. Just remember Patau syndrome will be having this P features like polydactyly and the cleft lip and cleft palate, and there will be presence of this cardiac defects like ventricular septal defects, and he will be having features of rocker bottom foot. Whereas in a case of Edwards syndrome, there will be presence of this elongated occiput. There will be presence of this elongated occiput. And since there is, it's like a E. This E we can draw, and this E will be joining together. So they'll be having this horseshoe kidneys. And next one is this. Here it means they also present with this cardiac lesions of VSG and the rocker bottom foot. Just humor. Next one, if you see this presence of gynecomastia and the presence of microtestis in a male, it will be suggestive of which syndrome? It will be suggestive of Klinefelter syndrome. We know it is the 47XX1. Okay, 47XX1. And when there is a how much number of X chromosome, there is a increasing in the malignancy chances. Fine, just remember this. It is known as what? Klinefelter syndrome. Next one will come on to the systemic part. In the systemic part, you need to remember just few cardiac conditions. Like if you are having a good heart and if someone is poor, you need to help them with two things. One with the shelter, means one with the food, next one is the shelter. So just remember, since he's having this good heart, which is seen in a case of Hachosium, they'll be having this hypertrophy of this septum. Septal hypertrophy, which is asymmetrical in nature. And the septal hypertrophy, they will be having this history of sudden cardiac death. They'll be having this features of this sudden cardiac death, remember. And along with this feature, they'll be having this hypertrophy. So this left ventricular cavity will looks like a banana shape. So to have a good heart, you will be having, means you will be share your food and the shelter. So the food here, it is the banana. And you will be able to see this appearance with this known as, and microscopic appearance, you will be able to see this helter shelter, means there is haphazard proliferation of this, it's known as this helter shelter appearance of this cardiac muscle fibers. Right? And this have a normal heart. You know, the left ventricle, it works a lot. So there will be a usual hypertrophy. Fine, there will be usual hypertrophy. And if there is old age, they can result in this concentric hypertrophy. This how this concentric means it's in a concentric shape. Whereas in the case of dilated cardiomyopathy, the heart will be dilated. The dilated that much, it will look much dilated and the cavity will be more. So in a case of dilated cardiomyopathy, just remember, as it is dilated, the ends will become tight. So it's due to the mutation. It is due to the mutation in the titin gene. And just remember, it is the largest gene. And Hachosium develops because of this mutation known as mutation in the beta myosin heavy chain. It is due to the mutation in the beta myosin heavy chain. Just remember these points about this cardiac lesions. And with this, we'll move on to our respiratory part. In this respiratory part, if you're able to see this type of spirals, could you please name, what is the name of this spirals in the chat box? Yeah, just remember, they are known as this Koshman spirals. Koshman's spirals. They're actually what they comes from the trachea. They are actually what the tracheal mucosal plaques. Mucosal plaques. Just remember, they are from the trachea. Next one. If you see this next one, you will be able to see crystals. Means, could you please name the crystal in the chat box? Just try to be active in the chat box. Yeah, I think so. Like Parnasian, he's giving most of the answers. If you just try to be active in the chat box, so that will be in the rhythm. Fine. Just you try to answer. Sometimes I'm not take your name. So, but just be active in the chat box so that we'll learn more actively. Fine. If you see the next one, it is what these crystals, they are known as what? Charcoal laden crystal. Charcoal laden crystals. Fine, they are known as this chalk-out laden crystals. And this chalk-out laden crystals will be containing this galactin 10. Galactin 10. They'll be containing this galactin 10, and mainly it will be from this eosinophils. Just remember. Next one. If you're able to see this type of epithelial cells, they're actually known as bodies. They are this epithelial cells known as Crayola bodies. They're actually what they are, this epithelial cells. Epithelial cells. Yeah, just be active. Right. With that, we'll move on to some other respiratory part. If you're able to see this star-shaped asteroid bodies, and one more body is known as Schumann bodies. Where you will see these two types of bodies? Could you please answer in the comment section? Just remember, you will be able to see these asteroid bodies and the Schumann bodies in a case of sarcoidosis. And in a case of gallium scan, you will be able to appreciate this panda sign in the face and the lambda sign. Panda, lambda. Just remember these two signs, they are seen in a case of sarcoidosis. And next, we move on to this next part. In this X-ray, you will be able to see this multiple irregular opacities. And these opacities, they are at the pleural level. They're at the level of pleura. And if they are at the level of pleura, it's due to the formation of this plaques known as pleural plaques. And these pleural plaques, they are seen in a case of occupational lung disease known as asbestosis. Remember, it is seen in a case of asbestosis. And asbestosis, most of these occupational lung diseases, they will ascend up, they will affect this upper lobe. Whereas this asbestosis, they will involve this base lobe or this lower lobe of the lungs. Fine. And this, in the case of this asbestosis or some other occupational condition also, you will be able to appreciate this type of bodies, this dumbbell-shaped bodies. They are known as this ferruginous bodies. Why they are known as ferruginous bodies? Because of this accumulation of these crystals, there is a deposition of this iron. And this iron, we can stain with the stain. What is the name of the stain we use for iron? Yeah, just remember. It is how this blue, it is blue in color. So it is what? It is the Pearl's Prussian blue. It is what? It is the Pearl's Prussian blue. Fine, it is the Pearl's Prussian blue. Next one, and few cancers about the lungs. We see about few cancers of the lungs. We see the presence of keratin pulse. This keratin pulse and this some of bodies will often you will get confused. Just read the history. If they're giving the history of the skin or the lung cancer, it will be of squamous cell carcinoma of lung. It will be having this keratin pulse. So remember, it will be the squamous cell carcinoma of lung. Fine, it will be the squamous cell carcinoma of the lung. That's remember. Next one, if you're able to see, this is the alveolar wall, and these tumor cells just along these alveolar walls like a butterfly sitting on the fence. So it is known as butterfly on the fence appearance. Butterfly on fence appearance. It is seen in a case of bronchoalveolar carcinoma. It is seen in a case of bronchoalveolar carcinoma. Just remember. Next one, if you see this involvement of these blood vessels by this tumors known as small cell lung cancer, also known as this oat cell lung cancer. If you see this involvement, okay, fine. If you see this involvement, it is known as what? It is known as azopari effect. It is known as azopari effect. Okay, there will be involvement of this blood vessels you will be able to see in a case of small cell lung cancer. And we know the small cell lung cancer, it will produce many type of hormones. So it can result in few syndromes like syndrome of inappropriate ADH secretions and Lambert-Eaton syndrome. We know Lambert-Eaton syndrome, it's due to because of this antibody against this PQ channel, which is a calcium channel, and it can result in the features like a myasthenia gravis. Just remember, Lambert-Eaton syndrome, it will be presented as a side effect of small cell carcinoma of lung. Fine. With this understanding, we'll move on to the kidney part. Just remember, this is how this normal staining of this is the normal kidney looks like. Then, if you see this type of focal lesions known as KW lesions, this will be suggestive of which disease you will be think of with this feature. Could you please answer in the comment section? Just remember, these KW lesions, they will be seen in a case of diabetes mellitus or this diabetic nephropathy. Fine, just a moment. And in a case of diabetes, you will be seeing this proteinuria or initial feature. There will be increase in GFR followed by this microalbuminuria. Fine, just a moment. Next one, if you see this crescent shaped on this HP examination, you will be able to see this crescent. Okay, crescent or the half moon. This crescent shaped involvement that is seen in a case of which condition? It will be seen in a case of nephritic syndrome known as RPGN. Okay, rapidly progressive glomerulonephritis. Fine, you just remember this about this thing. Next, if you are able to appreciate this effacement, means this blunting or this effacement of podocytes. If you are able to see this effacement of these podocytes, this effacement of podocytes will be seen in a case of which condition? Could you please answer in the comment section? Yeah, just remember this effacement of these podocytes, they will be seen in a case of minimal change disease. And we know minimal change disease is the most common cause of nephrotic syndrome in children. Just remember, it is the most common cause of nephrotic syndrome in children. Whereas the most common cause of nephrotic syndrome in adults, it is the what? It is the FSGS, which is known as this focal segmental glomerulosclerosis. It is the FSGS. Next, if you see this minimal changes, is the treatment for this minimal changes is it is what? It is the steroids. The treatment is the steroids like prednisolone. Just remember these few points, and if you want to remember a few more, just I will tell you 2 more points. Just remember, if they give you in history, if there is a presence of this spike and dome pattern of this deposition, and it will be seen in the case of membranous glomerulonephritis. Okay, it will be seen in the case of membranous glomerulonephritis. It's actually a nephrotic syndrome, and it can be seen in it is most commonly seen in elderly and cancer patients. Fine. Next one, this dome and spike pattern. Next, if you're able to see this tram track appearance of basement membrane, means splitting of this basement membrane. This occurs in a case of, remember this as membranous glomerulonephritis. If you insert this word P, it will split this M and G. So the splitting occurs in a case of membranous proliferative glomerulonephritis. Just remember. Next one, we'll come to some images, microscopic images of the stones. If you're able to see this hexagonal shaped stones. Okay, first we'll see this one. Okay, if you're able to see this hexagonal shaped crystals, hexagonal means 6. So remember 6 for 16 stones. 16 stones. And if you're able to see this stone known as this coffin lid appearance, means lid of a coffin. So this coffin lid appearance, it will be seen in a case of this stones known as Struve-White stones. Okay, it's also known as Stag-Horn calculi. We'll see about this in surgery. Fine. They're known as the Stag-Horn calculi. It happens because of this alkaline nature of the urine. This alkaline nature of the urine, it will be because of this infection with this protease, which will be having this presence of urease enzyme. They'll be having this presence of this urease enzyme. Just remember. Next one. If you see this, both of the crystals, they are made up of calcium oxalate. And so okay, calcium oxalate. So what's the difference, bro? Like if you see this, both of it, they're made up of calcium oxalate. Whereas this calcium oxalate monohydrate. Just remember, if you're single, you need to build up your body to get committed. So just remember. So to build up your body, you need to lift dumbbells. So if you're single, calcium oxalate monohydrate one will produce this dumbbell shaped appearance of this crystals. Okay, fine. We'll show this dumbbell shaped appearance. Whereas if you build your body with the dumbbells and you got committed. Once you got committed, you cannot stay like that. If you want to stay connected, you need to communicate to each other. How will you communicate? You will communicate with the previously used to communicate with letters known as envelopes. Okay, so this envelope shaped crystals, they are seen in a case of calcium oxalate dihydrate. Fine, just remember. And if you're able to see this rhomboid shaped crystals, They are seen in a case of uric acid stones. Uric acid stones. Just remember, they will be seen in a case of uric acid stones. Fine. This is about the stones you need to remember. And with this understanding, we'll move on to the GIT part. In GIT part, just remember there's 2 images. Okay, it will be mostly enough. If in a history there is a presence of some malabsorption, along with that, in a biopsy, you will be able to see atrophy of villi along with crypt hyperplasia. Crypt hyperplasia. And this villus atrophy along with this crypt hyperplasia, they will be seen in a case of celiac disease. They will be seen in a case of celiac disease. Fine, they will be seen in a case of celiac disease. Fine. Next one. This is about this celiac disease. Fine. And we know there is a dermatological association also, like dermatitis herpetiformis. Fine. We'll just remember this one point. It is associated with this dermatitis herpetiformis. Okay, fine. It's associated with this celiac disease, and we know the conception of bro. We won't go into details. We'll just limit our discussion along with it. Fine. Now, this is how this past time periodic acid stuff, how it looks like. Fine. If you see some kind of past positive macrophages in the lamina propria. It will be suggestive of which condition? It will be suggestive of this infection by this Treponema vippli. Which leads to this condition known as Whipple's disease. It leads to this Whipple's disease. So remember, if there is a past positive macrophages and the lamina propria, it will be suggestive of this Whipple's disease. Fine? Just remember. Next one, if you're able to appreciate this continuous involvement of bowel, along with this most common site of rectum being involved. Which type of inflammatory bowel disease you will suspect of? Answer in the comment section. Just remember, you will think of ulcerative colitis. You will think of ulcerative colitis. And the antibody which is being related to the ulcerative colitis, it is the which antibody? It is the P-ANCA antibody. So because of this antibody association, it can result in it can be associated with primary sclerosing cholangitis. Just remember, it can be associated with this primary sclerosing cholangitis. And if you're able to see this formation of stricture formation along with formation of fistula and along with this appearance of mucosa, it's not given here, this appearance of mucosa known as cobblestone mucosa. And this all of these features, it will be suggestive of our Crohn's disease. And we know in a case of Crohn's disease, the antibody which is being responsible is the ASCA. It is the ASCA one. Just remember. With this understanding, we'll move on to the next part, to the neuro. If you're able to see this, image, you can able to see this bilateral involvement with the spread through the corpus callosum. And if you see this radiological image, you'll be able to appreciate this bilateral involvement along with this central necrosis known as serpentinous necrosis. This will be seen in a case of, most commonly they will be seen in a case of frontal lobes, and these both of them they will be seen in a case. This will be seen in a case of glioblastoma. They will be seen in a case of glioblastoma. Just remember, this glioblastoma, it's a which grade tumor? Remember, glioblastoma, it is a grade 4 tumor. It is a grade 4 tumor. And it's about the glioblastoma unit tumor. And if you come to the next part, which is this rosettes, there are 2 types of rosettes. One is this true rosettes, and another one is the pseudo rosettes. Just remember, males they are pseudo because they live for others. Okay, and they means why they are pseudo rosettes? They live for others because they'll be having this central discoloration, which is pink in color. Most of them they live for either for their future mother, means like for their future one, or for their mother. So just remember this pink, if there is any pinkish thing inside, so it is known as pseudo rosettes, and it will be seen in a case of men, like seen in a case of medulloblastoma, Ewing sarcoma, and neuroblastoma. Okay, the neuroblastoma. Whereas this type of true rosettes means this flower-shaped arrangement of this blue round cells. So this flower-shaped arrangement of true rosettes, it will be seen in a case of which condition? It will be seen in a case of retinoblastoma. It will be seen in a case of retinoblastoma. Yeah, as you are getting it correct. Like Sankit and Parmanasian, yeah, just keep going, just keep answering. Fine, that's good. You are really awesome. Fine. With that understanding, will we move on to this? Just remember one more point about this rosettes. In the case of retinoblastoma, this true rosettes, they are known as Flexner Wintersteiner rosettes. Fine. Okay. Whereas the pseudo rosettes, they are known as Homer-Wright pseudo rosettes. They are known as what? Homer-Wright pseudo rosettes. Pseudo rosettes. Fine. They are known as Homer-Wright pseudo rosettes. Right. That's good. Fine. With this understanding, we'll move on to the next part of our RBCs. If you see this RBC, if you're able to see this target-shaped cells, along with these features of microcytic hypochromic anemia, and there is an index known as Mainzer index. If this Mainzer index, if it is less than 13, along with this presence of this microcytic hypochromic anemia and the features of target cells, and there will be a history of recurrent, repeated transfusions. Which disease you will think of? Yeah, you will think of which disease? You will think of thalassemia. You will think of thalassemia. Fine, you will think of thalassemia. And if you are able to appreciate this presence of this cells, which are known as this bite cells. Here also you will be able to see bite cells along on supravital stain. If you are able to see this presence of Hin's bodies. This both of them, they are seen in a case of G6PD deficiency. Just remember, this G6PD is a pathway in HMP and it is responsible. Yeah, you are getting it correct. Yeah. If you see this G6PD deficiency, this will result in the formation of this. This will help in to reduce this free radicals. So to help this free radicals, this G6PD works on. But if there is any deficiency, these free radicals, they will go and attack on the hemoglobin molecules and leads to this accumulation of these hemoglobin molecules as Hin's bodies. So remember, Hin's bodies, they are actually what? They will contain this hemoglobin. Fine. Next one. If you're able to see these features of macroovulocytes, along with this presence of this bodies known as Howell-Jolly bodies, along with this hyper-segmented neutrophils. Which disease you will think of? Could you please answer in the comment section? Just remember, yeah, you will see these features in a case of vitamin B12 deficiency, which leading to this megaloblastic anemia. Just remember, it will be leading to this megaloblastic anemia. Fine. With this understanding, we'll move on to few blood tumors. Fine. If you see this multiple stages of multiple immature myeloid derivatives, so this will be suggestive of this AML, acute myeloid leukemia. Fine. And in a case of AML, if there will be a translocation, and in which you will be able to see this type of rods, which are known as this R rods. You will be able to see this type of rods known as this R rods, and these R rods will be previously based on the classification. They will be seen in a case of AML M3. And now, if you're able to see these R rods, it will be because of this translocation, which is known as translocation 15 to 17. Translocation 15 to 17. I just keep answering. It is seen in a case of translocation 15 to 17, which is known as what? PML RARA fusion. This is seen in a case of AML. And if you're able to appreciate here, this image, it's just clumsy, right? Because you will be able to see this type of immature cells, this type, like banded one, like a metamyelocyte, myelocyte. But if you're able to see this image, they are all immature cells, but they are uniform in nature. This type of uniformity of lymphocytic immature cells, they'll see in the case of ALL. They'll be seen in the case of ALL. Fine, they'll be seen in the case of ALL. Next, you'll be able to see this type of lymphocytes which are mature in nature. Along with this, since there is no presence of this integrity, while preparing this slide, these cells will rupture and smudge. So they are known as this smudge cells. So these much cells and these lymphocytes, they will be suggestive of this CLL, means chronic lymphoblastic leukemia. Just remember this, just keep these images in your mind. That's it. Fine, you will be enough of exam. Fine. Next one, if you see this type of clover leaf type of cells, which are known as the Sézary cells, which are seen in a case of Sézary syndrome, okay, which is actually a T cell non-Hodgkin's lymphoma. We saw means the ALL can be B cell or T cell, okay, but here it is just a T cell one. And if you're able to see this type of appearance, could you please anyone answer in the chat box what is the name of this appearance? Means in a HPE known as just remember it is what it is known as starry sky appearance. Starry sky appearance, and we know this starry sky appearance. It will be seen in a case of Burkitt's lymphoma. It will be seen in a case of Burkitt's lymphoma. Yeah, it will be seen in a case of Burkitt's lymphoma. And we know this, there will be typical history of this African child, which will be presenting with this jaw swelling. So, jaw swelling, and there will be translocation of, just remember this B. If you make this B, it will become 8. It will be transformed into 8, and it is what? It is translocation 814. And why this is starry sky appearance? If you're able to see, there are lot of small blue tumor cells, which is the Burkitt cells. Right? Yeah, you are getting it correct, second. So these are these lot small cells. They are actually the tumor cells. Whereas the starry ones, they are what? They are this macrophages. So remember, who has the stars here? They are the macrophages. They are the macrophages. Just remember. Fine. And if you are able to see this type of hairy projections, so this is seen in a case of hairy cell leukemia. So remember, this will be seen in a case of hairy cell leukemia. And we know the marker for this hairy cell leukemia, it is the annexin 5. Whereas we know there is one more marker. Remember of annexin. Will you able to recall what is the name of another annexin? Where will you use it? Could you please answer in the chat box? Yeah, like images of Apta, it will be discussed in the tomorrow session. Today we'll be discussing ENT. Fine. So just remember, there is one more annexin marker, which is what? Sorry. In the case of hairy cell leukemia, it is annexin A1. Whereas annexin 5, you will be means you will use as a marker in the case of apoptosis. Apoptosis. Just remember, you will be used as a marker in the case of apoptosis. Just remember. Yeah, Apta will be discussed in tomorrow's session. And if you're able to see this kind of deposition around the cells, which are known as this MOD cells, which is also actually what they are, this light chain deposition. Light chain deposition in a case of multiple myeloma. In a case of multiple myeloma, you will able to see this MOD cells. Just remember these two things about this multiple myeloma. Fine. This is the light chain deposition. Light chain. Fine. And with this, we'll just had an overview about these images which are being asked in the pathology, and we'll move on to the next part. Okay. The next part will be of microbiology. Till then, if you have any questions, just put up in the comment section, or just keep it in your or write it aside. I will answer it. Fine. Till then, I think so. I'm not able to appreciate any questions. I think so. Everything is fine with you. Fine. If any questions, just post it regarding the patho. If not, we'll move on to our next part of our discussion. Yeah, fine. I'm not able to find any questions here. Yeah, fine. Then we'll move on to our next part. The next part is about this microbiology. And in the case of microbiology, if you see this enzyme, where this organism which is producing this bubbles or this gas, yeah, fine. If it produces this bubbles or this gas, it is what? It is what? It is the catalase enzyme. It is due to the presence of this enzyme known as catalase enzyme. It is due to the presence of this enzyme known as catalase enzyme. If organism, if it is positive for catalase, and the next one, if it coagulates, if it coagulates the test particle, so it is also positive for coagulase. And there are two types of coagulation. If you see, it's being done in a slide, and next one it is being done in a tube. So there will be a slide coagulation and there will be a tube coagulation. So if you see an organism which is both catalase positive, coagulase positive, and this organism, it will be producing this golden yellow colonies. Which organism you will think of, which is both catalase positive, coagulase positive, and produces this golden yellow colonies? Yeah, it is a golden. So remember, it is the Staph aureus. It is what? It is the Staph aureus. And next, we know the selective media which we use for this. The selective media we use for this staph, it is the mannitol salt agar. And this Staph aureus, it is the most common cause for many other conditions. For example, the Staph aureus, it is the most common cause for endocarditis, skin and soft tissue infections, and even osteomyelitis. Okay, these are the understandings you need to keep. Just remember these things. Next, this even results in the formation of toxins. For example, this can result in the staphylococcal scalded skin syndrome, which we'll see this image in dermatology. Next one, this can result in this toxic shock syndrome. For example, the females who are using tampons for in their menstrual cycle, they can be having this risk of having this toxic shock syndrome, or sometimes this can result into the food poisoning. And we know this staph aureus food poisoning or staph food poisoning, it will be having this incubation period of less than 6 hours. So the cases will be rapidly rising and rapidly falling, and these cases will be within one incubation period. And this type of staph food poisoning epidemic, it is known as single exposure, because one time you are eating pani puri. So this one time, it is what? Single exposure point source epidemic. Okay, you are eating one time in the evening. Fine, just remember. Okay, next one, we'll move on to the next part. If you move on to the next part, you'll be able to see this blood agar. In this blood agar means the organisms, based on the production of their hemolysis, they can be differentiated. For example, if organism produces complete hemolysis, if beta hemolysis means it produces this complete hemolysis. Alpha means it produces the partial one. Gamma means no or very less type of hemolysis. And based on this hemolysis, we classified the bacteria. Means we classified especially this streptococci. So there will be a group A beta hemolytic organisms, and there will be a group B. We'll discuss later. First, if you see this group A beta hemolytic organism, could you please name the organism which is included in this group A beta hemolytic? Answer in the comment section. Just remember the organism which is under the category of group A beta hemolytic, it is the Streptococcus pyogenes. Just remember. Next, we know this can lead to the formation of this pharyngitis, and this can even cause this skin and soft tissue infections, and this pharyngitis can progress into this rheumatic fever and rheumatic heart disease, and this can also even result in PSGN. Okay, post-streptococcal glomerulonephritis, and we know this PSGN is a type 3 hypersensitivity reaction. It is a type 3 hypersensitivity reaction. Just remember. And if you see about this next one, this is how this group B streptococci looks like. This group B mainly, it is the Streptococcus agalacticae, and this will be positive for this test known as CAM test. So it will be positive for this test known as CAM test positive, and it will produce this arrowhead hemolysis. I told they will produce hemolysis. So we'll use this to test the organism. So it produces this type of hemolysis known as arrowhead hemolysis, and they will be CAM test positive. Just remember. Next, this is the beta hemolytic one. And if you look upon to the alpha hemolytic organisms, the alpha hemolytic organisms, you remember just two organisms. One is this Streptococcus viridans and Streptococcus pneumoniae. And just remember about this Streptococcus viridans, it is the causative organism of one type of endocarditis known as subacute bacterial endocarditis. Remember this word. This Streptococcus viridans leads to this subacute bacterial endocarditis, and the Streptococcus pneumoniae, it is the most common cause of community acquired pneumonia. Okay, it is the most common cause of community acquired pneumonia. Okay, fine. This is subacute bacterial endocarditis. Okay, it is a subacute bacterial endocarditis. Just remember. And this is how this Streptococcus pneumoniae. We know the Streptococcus pneumoniae, it is a capsulated organism. So, as it is a capsulated organism, it will be show positive for this Quillings reaction. So, they will be positive for this Quillings reaction. Okay, it means it's just to test the capsule. Okay, and this based on this capsule will produce this vaccine known as pneumococcal conjugate vaccine. And will produce the vaccine known as pneumococcal conjugate vaccine. And cultivating with this blood agar, we know it will produce this alpha hemolysis, and it will produce this coins known as this carum coin colonies. Carum coin colonies and blood agar. They will produce this carum coin colonies and this blood agar. Just remember. Next one will come to another organism which is known as our favorite Bacillus anthrax. And to remember about this Bacillus anthrax, remember about a Halloween festival. You know, right? It means most of you are living in the foreign countries with the foreign cultures. So you know this Halloween festival. So in a Halloween festival, what you will do? You means like you are a small child. You are seeing a small child who she want to be dressed as a witch. Remember, it's WITC, witch. Fine. So since she want to dress as a witch, okay, fine. This is the cute girl, and like most of them, they're oldest people, right? So they'll be comfortable with a single clothing. So they'll be having this single gown type of clothing, and of course she's a witch, so she'll be carrying few beads to tell the mantras. Fine. Next, and to resemble more about the witch, okay, the old woman, she'll be having this bamboo stick with the central spores. Means bamboo stick with the central spores, remember. And since it's a witch, she's not going to do some good things. Like she want to do some bad things. So to remember to say this poisonous thing, she'll be having this head known as Medusa head. Medusa head means there will be this snake head. So these are this appearance, and she'll be having one more pocket to keep the plate, to collect the chocolates. What is the role of Halloween? To collect chocolates. Like from our perspective, to get chocolates do. That's it, right? So to collect these chocolates, she'll be having this plate. So just remember this girl, and we'll come to our main story. And if you see this image, this is how this culture of this Bacillus anthrax, it will show this Medusa head colonies. Medusa head colonies. This is how this Medusa head colonies looks like. How this Medusa head colonies. And this is how this string of pearls are the beads of pearls. String of pearls on culture. Fine, string of pearls and culture. And it's the gown, right? And this gown, it will resemble like a tree. So this is known as inverted. It will show a appearance known as inverted fig tree appearance, because it is a aerobic organisms. It go more on the upper surface. So it will show this appearance known as inverted fig tree appearance. Inverted fig tree appearance. Fine. And it will be cultured on a agar known as, or the medium known as flat medium. It will be cultured in a medium known as flat medium. And it will be a square-shaped organism with a central spore. So it is a spore-related organism. Just remember these things about this Bacillus anthrax. Then we'll move on to the next part, which is this, our Clostridium tetani. If you see this Clostridium tetani, you'll be able to see this drumstick-shaped one, and you will be able to see this terminal spores. Remember, it is the Clostridium tetani, and it is an anaerobic bacteria. So it will be grown in this media known as means RCM, also known as Robertson Cook meat media. Okay, Robertson Cook meat media. It will be used to culture the organs. Just remember about this Clostridium tetani, and we know this leads to the formation of tetanus, and it will incubate this GABA, which is an incubator neurotransmitter. Just remember these few things about this Clostridium tetani. Fine. With this understanding, we'll move on to our next part. Fine. If you see the next organism, which of the following organism which will show this pattern known as Chinese letter pattern? Answer in the comment section. Could you please answer in the comment section? Yeah, it will show the organism which show this Chinese letter pattern. It is what it is, the Corynebacterium diphtheriae. And the stain which is being used to stain this granules, they are what? Means if you can see this tip of this thing, they'll be stained with this they'll be containing these granules and is stained with this stain known as Albert stain. Albert stain, and these granules are known as metachromatic granules. Just remember, they are known as this metachromatic granules, also known as Burbst Ernest granules. Just remember. Okay, this is this Corynebacterium diphtheria. You know, it produces this bull-neck appearance, pseudomembrane. Okay, that's the clinical aspect. And to culture this, we'll use this media known as low flux serum slope. We'll use this media known as low flux serum slope. Fine. And next, this Corynebacterium diphtheria will produce this toxins. And to test these toxins, we'll use this test known as elect test. Elect test, in which if you're able to see this formation of this cross, means there is a presence of this antitoxins. There is a presence of these toxins which is being neutralized by this antitoxins. Just remember these few things about this Corynebacterium diphtheria. Fine. With this understanding, we'll move on to our next part. If you see the next image, you'll be able to see this gram-negative organism. Okay, gram-negative organism, which is responsible for this urethritis. Fine. And this urethritis, this species can result in this urethritis, by which organism known as what? Neisseria gonorrhea. How will you tell it is a gram-negative? Because you'll be able to see this pink color. Means if it is pink color, it is a gram-negative bacteria. Fine. So it is what? It is the Neisseria gonorrhea, which leads to this gonococcal urethritis. And this gonococcal urethritis be having this complication, or it leads to a syndrome known as this syndrome, in which you will be able to see this perihepatic adhesions. These perihepatic adhesions, they look like a violin string. So this violin string, because of this perihepatic adhesions by this Neisseria gonorrhoeae, it will be called by a syndrome known as Fitzhugh-Curtis syndrome. Okay, it's known as Fitzhugh-Curtis syndrome. Next one, we will be able to see features of meningitis along with these features of rash, and both of them they will be seen in a case of the same species, which is this Neisseria, and this is the Neisseria meningitis. Okay, just remember, in the case of Neisseria meningitis, you'll be seeing this rash along with these features of meningitis like photophobia and this Kernick sign positivity. Fine. And for this growth of this Neisseria, for this culturing, we'll use this media known as Thayer-Martin media. We'll use this media known as Thayer-Martin media. You just remember about this media known as Thayer-Martin media. Just remember. With this understanding, we'll move on to the next part. If you see this comma-shaped organism, so they're having this tiny flagellae, okay, tiny flagellae, and it is showing this darting motility. Darting motility are the shooting star motility, and it will produces this condition known as rice watery stools. All of these conditions, all of these things, they are seen in a case of infections with Vibrio cholerae. They are seen in a case of infections with this Vibrio cholerae. And in the case of Vibrio cholerae, you'll be able to see this, means on a slide, if you take up, you will be able to see this formation of sting. So this is known as positive sting sign. Just remember, it is known as the positive sting sign. Fine. With this understanding, just remember one more thing. To differentiate this different species of this Vibrio from the Vibrio cholerae and Vibrio parahemolyticus, we'll use this media known as TCBS media. We know this Vibria, they will grow on a huge salt, means they will be grow on a alkaline medium. So, and in this growth of this TCBS agar, it produces this yellow colony. So Vibrio cholerae and TCBS, it will produce this yellow colony, whereas other species of Vibrio like parahemolyticus, it will produce this green colonies. Fine. And remember, it is a comma-shaped organism. Like this is how this comma-shaped organisms look like. Fine. This is how these comma-shaped organisms look like. With this understanding, we'll move on to our next part. If you see a patient who is having this kind of air bubbles and having a recent history of trauma or an infection, and on pressing, you'll be able to see the crepitus. If you see this presence of this crepitus, it means there is a collection of air, means there is a presence of this condition known as gas gangrene. And this crepitus presence along with this gas gangrene will be suggestive of infections with Clostridium perfringens. Okay, Clostridium perfringens. And this Clostridium perfringens on cultivation with this blood agar, it will show this hemolysis known as target hemolysis. Target hemolysis. Just remember, we saw this target cells. Target cells, they are seen in a case of thalassemia, whereas this target hemolysis, it will be seen in a case of Clostridium perfringens. Fine. And this Clostridium perfringens, this will produces this type of fermentation known as stomy fermentation on this litmus milk. So it will produces this stomy fermentation on litmus milk. And we saw this group B streptococci, which is the Streptococcus agalacticae, they will produce this only one arrow, which is known as Camptis positive, whereas this Clostridium perfringens, it produces this two arrow known as reverse Camptis positive. They are known as reverse Camptis positive. And one more species of Clostridium is there, which is what? This is Clostridium difficile. And this Clostridium difficile will lead to this formation of the pseudomembrane known as this pseudomembranous colitis. Okay, pseudomembranous colitis. Just remember, it will lead to the formation of this appearance known as pseudomembranous colitis, in which you will, in the colon, you will be able to see this formation of pseudomembranes. Fine. With this understanding, we'll move on to the next part. If you see this thing, it is this agar known as buffered charcoal yeast extract. And this base media, it is used for culturing of Legionella. And remember, this Legionella, it will be presenting with features of atypical pneumonia. And sometimes this can even present with the features of diarrhea. And we know the mode of contamination or the mode of spread is by the contaminated AC vents. Remember, there will be a history of this contamination of this AC vents. So this contamination of AC vents. Just remember, this is by this Legionella. Just remember. Fine. Next one, this is how this Macconchi agar looks like. And this Enterobacteriaceae family, which are lactose fermenters, like E. coli and Klebsiella, they will be producing this pink colonies. Okay, they'll be producing this pink colonies. Fine. Excuse me. Fine. Just remember this E. coli and Klebsiella, they will ferment this. They will be ferment this lactose. So on Macconchi agar, they will produce this pink. Okay, just remember as a roseman. Fine. Next one. If you're able to appreciate what is this type of microscopy, will think of. Just remember, what is this microscopy? Remember, this is a dark field microscopy. Because everything is dark here. And in dark field microscopy, if you're able to see this corkscrew, means like it will showing this corkscrew motility, or this spiral shaped organisms, which are actually what? Spirochetes. And it will show corkscrew motility. We know this one spirochete organism, which is known as what? Treponema pallidum, which causes the syphilis. Just remember. Next, if you see this image, you'll be able to see this motility known as swarming motility. And the swarming motility, it will be exhibited by which organism? Just think in your mind or answer in the comment section. Yeah, it will be seen with the organism known as Proteus. So this Proteus will be showing this swarming motility. And if you cultivate one or two different species of this Proteus, it will show a phenomena, means this waves, it will show a phenomena known as Dine's phenomena. Just remember. Okay, it will show this phenomenon known as Dine's phenomenon. Next one. If you are able to appreciate this ulcer, there is a corneal ulcer. And if you see these margins, they are regular. margins. So it is a kind of bacterial ulcer. And if it is a bacterial ulcer, what is the most common cause of bacterial corneal ulcer? If you remember, the most common cause of bacterial ulcer, it is what? Bacterial colonial ulcer, it is the Pseudomonas. Pseudomonas. It is the Pseudomonas. And we know the Pseudomonas, it will be act by this mechanism. These two organisms like Corynebacterium, diphtheria, and Pseudomonas. These both organisms, they will incubate this 2-1, which is this elongation factor 2. It will incubate this elongation factor 2. Just remember. And this is how this Pseudomonas ulcer looks like. Fine. With this understanding, we'll move on to our next part. Fine. With this understanding, we'll move on to our next part. And next, our mycology part. In mycology, first see, this is a fluorescent stain. You'll be able to see this fluorescence, right? And this fluorescent sign, this fluorescent stain, which is being used in the case of fungus, it is what? It is the calcofluor white. It is the calcofluor white stain. Just remember the fluorescent stain used in a fungus, it is what? It is the calcofluor white stain. And if you're able to see this blue stain, it is what? It is the lactophenol cotton blue. Okay, just remember this stain will come to the organism now. So if you see this, if you want to see this culture morphology of the organism, you will see this using this stain known as lactophenol cotton blue. Lactophenol cotton blue. Fine. Next, if you see this stain, which produces this black pigmentations over the organisms. So this is what? This is what? This is the Gomery methylamine silver stain. So since it is a silver stain, you know the silver stains, they will produce this black color pigmentations. So this is how this Gomery methylamine silver stain looks like. Fine. Next, if you see this stain image perfectly, you will be able to see this acute angular branching. So this acute angle branching, along with this septations, this both of them, they will be seen with which organisms? Both of them, they will be seen in a case of Aspergillus. And there are different species of Aspergillus. Just remember this Aspergillus fumigatus. This Aspergillus fumigatus species. This will be showing this culture morphology like the fumes. We know the fumes goes up. So this Aspergillus fumigatus species, they'll be showing this appearance like a fumes going up. Okay, fine. And this Aspergillus niger, we know niger means black. So it will be producing this black colonies. So this Aspergillus niger will produce this black colonies. Just remember. Next one, if you see, there is this is how this tinea capitis looks like. You know, there are different types, different things in the tinea capitis. Okay, there is a Kirian, there might be a favus. So if you see a tender, okay, tender, and like this boggy swelling, and if you pluck this hair, if there is a easy pluckable hair, all of these three things, it will be suggestive of the Kirian type of tinea capitis. It will be suggestive of Kirian. Okay, it will be suggestive of this Kirian. Next one, the agar, the most common agar which we use to cultivate this fungus, they are what? They are this Seborrhoeic dextrose agar. We'll use this Seborrhoeic dextrose agar for cultivation. And on cultivation with this Seborrhoeic dextrose agar, if you're able to see this creamy pasty, in how sweet means creamy pasty colonies on SDA, it will be suggestive of, this will be suggestive of which organism? This will be suggestive of Candida. Okay, this will be suggestive of this Candida. Fine. And this Candida, on incubation, it will be showing this formation of the germ tube. And this formation of the germ tube, that it will be known as a phenomenon known as Raynaud's phenomenon. It will be known as Raynaud's phenomenon. Just remember about this phenomenon. Fine. With this understanding, we'll move on to our next part. There is a patient, means I don't have this image, we'll see this image on dermatology. So if a patient who is presenting with hypopigmented lesions on this trunk, okay, hypopigment lesions over his chest and the trunk, and on KOH mount, you'll be able to appreciate this spaghetti and meatball, or the vegetarian variant of this, which is what? Which is the grapes and banana. the banana and grapes appearance and spaghetti and meatball appearance, it will be suggestive of which organism? It will be suggestive of this Tinea versicolor. It will be suggestive of this Tinea versicolor. Okay, it is this suggestive of Tinea versicolor, which is caused by this Malassezia furfur. And on cultivation of this STA, it will means it's a non-veg organism. It will be showing this fried egg like colonies. Okay, fried egg like colonies. You just remember about these things about this Tinea versicolor. Fine. Yeah, fried egg colonies. Next one, if you see this image, like they'll be asking you this question, like identify the type of fungus, and they'll be giving these three options: Trichophyton, Microsporum, and the Epidermophyton. And there will be two conadias. In fungus, there will be two conadias. One is this Microconadias, next one is the Macroconadias. Macroconadias and Microconadias. And how you will able to differentiate this? Just remember, text me. Okay, it's just a mnemonic. Remember, it's a mnemonic. Text me in personal chat. It's a mnemonic. Fine. So remember, it is the text me in the personal chat. Okay, in the personal chat. So remember, in the case of Trichophyton, it involves three structures. It involves both hair, nail, and skin. Whereas this Microsporum and Epidermophyton, it will involve just two structures. The alphabet which is adjacent to this alphabets, they won't involve. So it will spare the nail. So the Microsporum will spare the nails, whereas this Epidermophyton will spare the hair. Just remember, it will spare the hair. Fine? Yeah, you are getting it correct. It will spare the hair. Then this Trichosphyton, it will show this pencil-shaped appearance. It will show this pencil-shaped macroconadia. It will show this pencil-shaped macroconadia. Whereas this spindle-shaped will be shown by this Microsporum. Spindle-shaped. This Epidermophyton, it will show this club-shaped one. It will show this club-shaped one. And this is how you will be able to cram this macroconadia. Whereas if you want to remember about this microconadia, remember, who will go to the club? The macro peoples, the big peoples. Or else you can remember this boys who are standing outside the gym boys, means outside the clubs. So there are big people. So don't go for this boys. Just remember, who will go for the club? They are the macro peoples. So there will be less micro or so no socioeconomic peoples in the clubs. So there will be a less microconadia here. Whereas here and here there will be abundant, whereas most abundant in a case of Trichophyton. Just remember these things about this Trichophyton, Microsporum, and Epidermophyton. With this understanding, we'll move on to the next part of our mycology discussion, which is the dimorphic fungus. Dimorphic fungus. In the case of this dimorphic fungus, to remember this organism, you remember as this mnemonic as body heat perfectly changes shape. Like for example, means you are fat and you want to lose your weight, you want to fit. And if you lose your fat by heating up your body, like running, then you will get the perfect shape. Okay, so body heat perfectly changes the shape. Just remember this thing. So we know it is the blastomyces, and H for histoplasma, and P, just remember, don't confuse it. It is the Paracoccidioidomycosis, then the Penicillium marnafi, and C for the Coccidioidomycosis, and S for Sporotrix shampoo. Just remember these organisms. Fine. And with this understanding, we'll move on to this respective dimorphic fungus. And if you see this large spore along with this spherule, along with the spores inside, means the large one along with the small one. So this coccidio, put this O inside. So there will be a large one inside the small spherules. So this will be seen in a case of coccidioidomycosis. And this coccidioidomycosis, remember this disease which causes this. Remember by this mnemonic of BCD, means it results in this conditions like valley fever, okay, which is the coccidioidomycosis, and the D for desert rheumatism, desert rheumatism. And you can able to see there is a large spherule inside, there are small spherules. And on culture, I told on culture, which stain will use? Will use this lactophenol cotton blue stain, and it will show this barrel shaped spores on the lactophenol cotton blue stain. Fine. And if you're able to appreciate this pilot wheel appearance or this merinal wheel appearance, pilot wheel appearance will be seen in a case of paracoccidioidomycosis. Fine. This paracoccidioidomycosis will produce this pilot wheel appearance. Next one you need to look upon it is this Penicillium marneffi. Just remember about this Penicillium marneffi. Remember this Penicillium marneffi, it will show this type of appearance known as P for P, show this paintbrush appearance. And remember the reservoir for this, it is the bamboo rats. So remember, if our mother saw a rat in her home, she uses her weapon, which is the broomstick. So it also shows an appearance known as broomstick appearance. So on culture, you can able to see either it is the paintbrush or this broomstick appearance. Fine. And if you're able to appreciate this tubercular shaped spores, this tubercular shaped spores or this acroponidia, it will be seen in a case of which one? It will be seen in a case of histoplasmosis. And just remember this histoplasmosis. Remember, it's a evening of means like means you want to go for a date with your darling. So you are going for a date with your darling. Okay, so it's known as darling disease. So initially you plan to visit the OU. So but since there are a lot of issues you are facing, so you didn't went for OU. So remember it's the disease also known as this Ohio's disease. And since you plan for OU, but you couldn't go there because you couldn't afford it. So what you will afford, it's just a cave. Okay, so you just took your trip, means or else you can remember, you just took your trip to a cave with your darling and you book your OU hotel to stay. Just remember. So it's known as darling disease, Ohio's disease, also known as caves disease. And you know in caves there will be a lot of bats. So it will be spread by the bats. Fine. So just remember this is about this histoplasma. Fine. With this understanding, we'll move on to our next part. If you see this kind of rosette appearance and on histopathological examination, if you see this asteroid bodies, like how we see in a case of sarcoidosis also, here also you will be able to see these asteroid bodies, and there is a phenomena you will be able to see here. It is known as the splendid Hopley phenomena. So these are all seen in a case of, this is known as Rose Gardner's disease. Also known as, which is actually what? Sporotrichosis. Fine, it is what it is, the sporotrichosis. Just remember this thing. Rose Gardner's disease, sporotrichosis. It will show this S for S, which is the splendid Hopley phenomena, and it will show this asteroid bodies. Or else you can remember, just you want to propose to a flower, which is a girlfriend, on a rose garden, because flowers, it need to be kept in the garden, right? So you want to propose to your flower in the garden, which is in the rose garden, and accidentally got some thrown trick even. And after proposing to the rose in the rose garden, she accepted it. So you became happy. So another word for happy, or the synonym of happy, is the splendid or joy. And so this will show this splendid Hopley phenomena. Next one, after she accepting, you plan to stay there and you want to enjoy this moments of sky, evening sky, where you will able to look this asteroid. So you will able to see these asteroid bodies in a case of sporotrichosis. Just remember. And if you're able to appreciate this broad-based budding, are in a shape of 8. Okay, it will be seen in a case of blastomycosis. It will be seen in a case of blastomycosis. Okay, and it is also known as Chicago's disease. Fine, just remember. It is also known as this Chicago's disease. Fine. Next one, just remember one point about chromoblastomycosis. It is not a dimorphic fungi. We saw already the dimorphic fungi, which starts with C, which is the coccidioidomycosis. Whereas chromoblastomycosis, it is being repeatedly tested, so your mind will get adapted. It is also a dimorphic fungi. No, chromoblastomycosis, it is not a dimorphic fungi. Remember, it is not a dimorphic fungi. And there will be a clinical features of verrucous lesions. There is a presence of verrucous or warty lesions. And HP examinations and histopathological examinations, you will be able to see this body is known as medullary bodies. Bodies are also known as this sclerotic bodies. Medullary bodies are sclerotic bodies are also known as this copper penny bodies. Okay, these are most commonly seen in this farmers who are walking in the barefoot. And if you see this kind of appearance of foot, along with this multiple discharging, along with this pus discharging through multiple sinuses, you will suspect of which disease. Just keep in your mind, you will think of this mycetoma. Okay, which is by this Madrella mycetoma. We'll discuss about this more detail in the derma part. Fine. This is how this mycetoma or this Madura foot looks like. Or this Madura foot looks like. Okay, so the Madura foot looks like. And if you're able to see some kind of mulberry-like mass which is protruding from nose, it will be seen in a case of rhinosporidiasis. Okay, rhinosporidiasis. And you can be able to appreciate in a H&E examination, you'll be able to appreciate this multiple spores. And it is most commonly seen in southern part of India, where there is a more who they bath more in more association with swimming in ponds. Could anyone? Okay, fine, swimming in the ponds, and it is not a culturable organism. Fine. Next, if you're able to see this image, you'll be able to see this type of staining. Could anyone in the chat box be able to answer me? Could anyone in the chat box be able to answer me? What is this name of this microscopic image? Yeah, means what is the type of this staining which is being used here? It is what? It is the negative staining. It is the negative staining which is being done here. And this negative staining, it is being done for the capsule. It is being done for this capsule, for this organism known as Cryptococcus neoformis. Okay, Cryptococcus neoformis, and we know it causes this meningitis in this HIV patients. And if you see this crushed type of ping ball or this indented crushed ping pong ball appearance, you will see this kind of crushed ping pong ball appearance. You will be seen in a case of pneumocystis carne pneumonia. You will see in a case of PCP pneumonia, which is this pneumocystis carne pneumonia. You just remember this thing about this. Fine. With this understanding, we'll look into this few part of our parasitology. In parasitology part, you need to remember just few things. If you're able to see this type of abscess, this type of abscess, which are known as this Anchovy sauce appearance. Anchovy sauce appearance, along with this flask-shaped ulcer. Both of these things, they'll be seen in a case of amoebic colitis. They'll be seen in a case of amoebic colitis. Just remember, they'll be seen in a case of amoebic colitis. Fine. Just remember. And if you're able to see this organism, this is the giardia. And this giardia, remember, this will show this motility known as falling leaf motility. It will show this motility known as falling leaf motility. It will be showing this motility known as falling leaf motility. Remember this giardia gradia. So it will show this falling leaf motility. It will show this falling leaf motility. Next one, if you see this tiny one, okay, this tiny one and this wet mount, you will be able to see, or this saline microscopy, you will be able to see it is what it is, the trichomonas. It is the trichomonas, which leads to this trichomonas vaginalis. Okay, could anyone in the chat box will be able to answer me what is the name of the motility which will be seen in a case of trichomonas? Yeah, it will show kind of twitching motility. It will show a kind of twitching motility, and the drug of choice or the treatment for this trichomonas vaginalis, it is what it is, the metronidazole. It is the metronidazole. It is the metronidazole. Okay, it is the metronidazole one. Fine. Next one, if you see this parasite, which will be having the cilia, the only ciliated parasite is causing infections in human. It is what it is, the Biochemistry coli. It is the Biochemistry coli. It is the only ciliated protozoa, other parasite. Fine, it is the only ciliated one. You need to remember. Fine, if you see cilia, you just remember it is the Biochemistry coli. Fine, and this is how this organism known as parasite protozoa known as acanthamoeba looks like. And we know this acanthamoeba can lead to this keratitis or this ulcer formation. This leads to this formation of ring-shaped ulcers. And this type of ring-shaped ulcers, they are most commonly seen in this contact lens wearers who wash their contact lens on the water. So this acanthamoeba type of ulcers, they are seen in a case of contact lens users who washes their contact lens on water. Fine, you just remember this thing. Fine. With this understanding, we'll move on to few types of eggs. Means these types of eggs, they are asked in the exams. Fine. If you see some kind of open lid appearance, are they also known as this open lid appearance, also known as this operculated eggs. Okay, this operculated eggs, this will be seen in most of or all trematodes. All trematodes will show this operculated eggs, except our single one, who is the schistosome, which is the schistosoma one. And there are different species of schistosoma. Since it won't show this operculated or this open lid eggs, it will show this type of, it will show this presence of the spine. If it shows a lateral spine, it is seen in a case of schistosomia mansoni. Remember, man will be having this lateral spine, and whereas the schistosomia hematobium will be having this terminal spine. Okay, terminal spine. And the schistosoma hematobium can result in the squamous cell carcinoma of bladder, of urinary bladder. Fine, you just remember it can result in the squamous cell carcinoma of the urinary bladder. Next, if you see, if there is no, if you are not able to appreciate any type of spine, whereas you will sometimes you'll be able to appreciate this formation of this knob. This knob will be seen in the case of japonicum. Okay, schistosoma japonicum will show this rudimentary spine, which is known as this knobs. Fine. With this understanding, we'll move on to few other eggs. If you see this two polar knobs, imagine as a chashma or the glass. Means who used to wear? Our Nana used to wear these glasses. So this old Nana used to wear these glasses, and since most of the times it will be falling off, they will be tying with a thread. So they will be tying with a thread. So there will be presence of this polar knobs and this polar filaments, and inside you will be seeing this presence of hooks also. And these are all suggestive of the eggs of H. Nana. Okay, and this H. Nana, we know for most of elderly patients. Yeah, fine. Yeah, it's correct. Yeah, Diga, you are getting it correct. And most of our elderly peoples, they won't walk straightly, so they will bend and walk. So just remember, they will be dwarfed than others. So it is also known as what? Dwarf tapeworm. It is also known as what? Dwarf tapeworm. And next, if you're able to see this plano-convex lens, along with this lava inside, this will be suggestive of this form known as this Introbius vermicularis. Introbius vermicularis. Fine. This will be suggestive of this Introbius vermicularis. Okay, the planar convex lens along with this lava inside. And if you're able to appreciate the next one, this bilateral mucus plugs and like a dumbbell one, like a bilateral mucus plugs, like a dumbbell one, and they will be present with some special features of coconut cake rectum. Yeah, you are getting it correct. Yeah, means they will present with this coconut cake rectum. So it will be suggestive of this dumbbell shaped means like dumbbell shaped kind of dumbbell shaped express because of the presence of this bilateral mucosal plugs. So this will be seen in a case of triturus trichura. Okay, just remember. Okay, triturus trichura. Fine. Yeah, you're getting it correct. Fine. Then if you see the some other parasites, like for example, in the case of Plasmodium falciparum, like you need to remember just two things. In the case of Plasmodium falciparum, you'll be able to see this multiple ring forms inside the RBC. So this aqual forms, there will be a multiple ring forms in a case of Plasmodium, whereas in a case of Vivax, Malariae, and Voveli, there will be a single forms. Fine, there will be a single ring. Whereas falciparum, there will be a multiple rings. And this gametocytes of this falciparum, how will you write this F? This F, it will looks like a long one, so it will show this banana-shaped gametocytes. It will show this banana-shaped gametocyte also. Just remember about this Plasmodium falciparum. And with this understanding, if you move to the next part, if you see this Maltese cross appearance, we see this Maltese cross appearance. This Maltese cross appearance inside this RBCs will be seen in a case of which condition? Could you please answer me in the comment section? Yeah, fine. Yeah, you are getting it correct. This will be seen in a case of babesiosis. Okay, this will be seen in a case of babesiosis. Fine, just remember this. Fine. And next one. This is how this Kala Azar looks like. Okay, this is how this Kala Azar looks like. Could anyone type in the chat box like what is this vector which is responsible for this Kala Azar? We'll see this vector in the tomorrow, means in the upcoming PSM session. Fine. This vector responsible for this Kala Azar, it is the sand flake. Remember, it is the sand flake. It is the sand flake. And antigen, yeah, the antigen which is being used for this Kala Azar testing, it is the RK39 antigen. And remember, this will be caused by this organism known as Leishmania donovani. And this will be showing this type of bodies known as LD bodies, known as Leishmania donovani bodies. Yeah, you are getting it correct. Fine. This is how this Kala Azar looks. Fine. With this understanding, we completed this micro. Fine. And just remember, we cannot go back in time, but we can start with whatever we are. So just try to remember. Just try to remember. Like if you didn't prepare well enough till now, also it's okay. You have 28 more days. Fine, you have more 28 days. And if you start your preparation even now, you can get a highest score in the exam, not the passing. You can get a highest score in the exam. So just be prepared for it. Don't worry about the past. Just start from today, start from now, and have a best of it. Fine. With this, we'll take a 5 minutes break. Just remember, it's a 5-minute short break. And after this session, after these things, we'll be having a discussion of this PSM, Pedia, ENT, and anesthesia. Okay, fine. Like take a 5-minute short break. We'll be back at exactly at 8:50. Fine. We'll back at exactly at 8:50. Remember. Okay, doctors, we'll resume our thing. Okay, will you able to hear me clearly? Answer in the comment section. Answer in the comment section, please. Will you able to listen to me clearly? Yeah, fine. Yeah, Divya, then okay, doctors. Then we'll start our session. Okay, fine. Next one is about PSM. Okay, we'll be having PSM, ENT, Pedia, and Anesthesia furtherwards. Like our discussion, it will be like it will take around another 2 hours or 2 hours 15 minutes. Fine. So just if you're having your dinner, just keep it with you and just have along with the session. Fine. That's what I will tell you. Fine. With it understanding, we'll move on to our next part of the session. And if you see this few study designs, you need to remember about in the case of PSM. In PSM, you need to remember few study designs. For example, if you see a case, if you see a case of in case of case control study, we know case control study, we cannot measure any incidence or prevalence, but we can measure a ratio known as odds ratio. Okay, odds ratio, which is also known as this cross product ratio. They can give this image in time, means like there is an onset of disease and you are asking just history about this exposure. So this thing will be seen in a case of case control study. Whereas in a case of cohort study, there might be of two different types. Either you will go to the exposed one, unexposed one, and you can collect the history and come back in time. Whereas in a case of retrospective, I mean, this is known as the prospective cohort study. Whereas in the case of retrospective one, you will be already having the data. You will just interpret and you will just assess the risk factor for it. So in the case of cohort study, which thing you will able to interpret? Yeah, Divya, you are getting it correct. We'll able to identify the incidence. And we know the most famous one of this cohort study is the Framingham heart study. Okay, it is the Framingham heart study. Just remember this about this study. Okay, fine. Then if you see this thing, this is how this case control study is being done. Means you'll be having these cases along with this normal people as a control. Fine. Next one is the cross-sectional study. Cross-sectional study means you will take a calculation, means like at this time, how many people they are scrolling the Insta reels. If you take at this moment, it is known as this snapshot. It's not Snapchat, it is known as snapshot study. And it will tell you this at this moment, means it will tell you the which one? Yeah, it will tell you the prevalence. Yeah, the cohort, it also will tell you the relative risk. Okay, fine. And the snapshot study or this prevalence study, which is what actually what cross-sectional study, which is the cross-sectional study. Okay, fine. With this understanding, we'll move on to the next part. As we discussed in this staphylococcus, it can result in this staphylococcal food poisoning. Fine. This staphylococcal, yeah, but student, you are getting it correct. Yeah, in the case of staphylococcal food poisoning, this will be in a single incubation period. So there will be a rapid rise and there will be a rapid fall in the cases. So most of the cases, it will be within one incubation period. Fine, there will be one incubation period and there will be no transmission. And there is a rapid rise and rapid fall in cases. Okay, there is a rapid rise and rapid fall in the cases. And this will be an example of, yeah, this will be one of the example. It is the Bhopal gas tragedy. And next one, what we studied just few minutes before, it was the staph food poisoning. It is the staph food poisoning. And this all of the following, they are example for the single exposure point source epidemic. Okay, fine. Whereas in few cases, we'll able to see a graph in which there is a multiple peaks. And the source is a single. So if you see single exposure multiple point source epidemic means like if you see means like multiple exposure. Sorry, it is a multiple exposure point source epidemic. There you will be able to see the multiple peaks. There is a multiple peak. Yeah, they're able to see these multiple peaks, and they'll be with varying incubation period. They'll be having this varying incubation period. And here also there is no person to person transmission. And the example for this is this milkman. Yeah, it is the contaminated well or the milkman. It is the milkman delivering milk or the contaminated well. Okay, fine. It is the contaminated well. And in epidemiology also, you need to just remember one more thing, like this: how this first or the disease can be detectable by screening, and this is the symptoms onset, and this is the usual time we do a diagnosis. Fine. Whereas between this time which we can direct from the screening to the usual time of diagnosis, it is known as the lead time. Okay, you just remember this definition. It is known as the lead time. They can give you this point. What is the name of this point between A, B, and C? What is the point between the A and C? So it is known as the lead time. So remember this thing. Fine. With this understanding, we'll move on to the cold chain. If you see about this cold chain, this is known as this ice-line refrigerator, and this will be kept at which level? Where you will keep this ice-line refrigerator? At subcenter level? Could you please answer in the comment section? Yeah, we'll keep this ice-line refrigerator at the pHC level for the storage of the vaccines. And in this, the freeze sensitive one will keep in the upper level, whereas in the heat sensitive one will keep. Yeah, means like the time which we detect from the screening to the usual time of diagnosis, it is known as lead time. Yeah, it is the ice-line refrigerator. Next one, if it means the freeze level one, they are kept in above, whereas this heat level one, they are the freeze sensitive ones, they are kept at the below. Fine. And just remember about these vaccines, and to note this proper or this exact cold temperature, we'll use this vaccine as a monitor. Means just remember, it is means they will check your heart as a monitor. Okay, they will check your heart as a monitor. So there are the so TD will be used as a heart. So they will tell the exact maintenance of this cold chain. Fine. They will tell this exact maintenance of this cold chain. Fine. With this understanding, you just remember there are few more points you need to remember about this cold chain. Next one is this open vial policy. Open vial policy means you can withdraw multiple times from a single vial. Means, for example, multiple vial vaccines. For example, in the case of pentavalent vaccine, you cannot throw with a single use, right? So you can withdraw for multiple times. For example, OPV vaccines, we need to give multiple doses. So they will follow this open vial policy. Whereas few vaccines, they won't follow this open vial policy. The example or this mnemonic to remember them is this: Mera, Rotava, Bacha, Jija, and COVID. Okay. Fine. Means the MR vaccine, BCG vaccine, Japanese encephalitis vaccine, they won't obey this open vial policy. They won't obey this open vial policy. You just remember. Fine. No, sorry. Yeah, they won't obey this open vial policy. Just remember. And since they are kept around near to the OPV, means they are kept around the OPV, which is near to the base. Fine. Just remember. Next, this is how we check this maintenance of this cold chain. To check this maintenance of this cold chain, we use this thing known as vaccine vial monitor, and in which there will be an inner square and an outer circle. There will be an inner square and an outer circle. Fine. So if this inner square, if it is lighter than this outer circle, we can use it. So we can use it in a case of case 1 and case 2. Whereas if it is equal to, or if it is more than the outer circle, then you will avoid using those vaccines. So this is how this VVM looks like. Next one, what you will be able to see, it is known as this dial thermometer. Dial thermometer. And this dial thermometer, it is used for measuring this temperature in this ice-line refrigerator. It is used for measuring this temperature in this ice-line refrigerator. Just remember. Fine. Next one. This is how this vaccine carriers looks like. in which you will able to keep 4 ice packs, and you can keep around 16 to 20 vaccine vials. You will able to keep around 16 to 20 vaccine vials. Whereas here, this is a single ice pack. This is a single ice pack. Yeah, this is a single ice pack. Whereas if you see this one, you can able to keep how much vaccines? You can keep 1 vaccine here and there, one above and 1 below. So you can keep 2 vaccines, which is around 2 vials. You can keep in a case of this ice packs. Fine, this ice packs. Yeah, ice packs. And this is the smallest. Just remember one more thing. It is the smallest component of cold chain. This is the smallest component of cold chain. Next, this is how this demographic graph looks like. And if you see this demographic graph, just imagine your college stories. In first year, you and your books, you travel along together. Means first year your intention is to study. Whereas in the case of from second year, means you realize that studying only doesn't need for your life. You need to just enjoy. So the distance from you and the book, it will get increased at the end of second year. Whereas in third year, you will start thinking, bro, we're done with third year, but we don't have any clinical knowledge. So we need to gain something. So then you start thinking about study. Still, you are thinking about study. Then once you start thinking about studying, you try to bring your books closer to you, and you start studying. Now, you will be having more books when compared to your friends. So just remember the story and will correlate along with it. So if you see in case of stage 1, the birth rate and the death rate, both of them will be at the high. Means you and your book, you are together. Whereas in a case of stage 2 of the growth cycle, this death rate, it will fall rapidly. So there is a formation of gap. Yeah, you are getting it correct. India is in the stage 3. Okay, so this maximum demographic gap, it will be seen in the case of stage 2. Whereas this demographic gap, it will start contracting by the early stage 3. It will be start contracting by early stage 3. Next, and in a 5th year, on your final year, means you will be having lot of books, so that you couldn't even take it from flight, so that you will get extra baggage, right? You need to get some extra baggage. So you will be having lot of books when compared to your friends. So here there will be a negative demographic gap. So negative demographic gap, it will be seen in a case of stage 5. It will be seen in a case of stage 5. Yeah, India is in the stage 3. That's remember. Fine. Next one. There are a few instruments which are being used in this PSM. For example, if you see this image, it is how this infantometers looks like. This infantometers used to measure the length of the child, and it can measure up to 2 years. Next one, if you see this next one, it is the Salter scale. It is known as this Salter scale, which is being used in most commonly in Anganwadis to measure the weight of the child. Fine. Next one, it is the Shakis tape, which is used to measure the mid-arm circumference. Like, okay, fine. And if it is less than 11.5, then the child will be having severe malnutrition. It will be having the severe malnutrition. Could you please identify what is the name of this instrument? Yeah, you are getting it correct. It is what? It is known as Harpendence caliper. Okay, and it is used to measure this skin fold thickness. It's used to measure this skin fold thickness. Fine. It is used to measure this skin fold thickness. Yeah, you are getting it correct. Then we'll come to few things about the school health. In school health, we'll use this type of bench known as negative desks. Means the desk will be here, and means we won't sit here. Means we won't sit near to it also. We'll sit somewhat inside. So that it is known as negative type of desk. So you can see they're coinciding. So this is known as what? Negative type of desks are also known as minus desks. And there will be one urinal in school health. In school health, just remember, there will be one urinal for 60 students, and there will be one latrine for 100 students. Yeah, for 100 students. Yeah, you're getting it. Fine. Next one, the per capita space the per capita space which is required is the per capita space required is the if it will be more than 10 square feet per children. Fine. This is about the school health. Next one will come into the next few instruments. Like this is how this kata thermometer looks like. And you know what is the use of this kata thermometer? Remember, this kata thermometer, it is used to measure this low air velocity. Low air velocity. Just remember, it is used to measure this low air velocity. Okay, fine. And if you see this, it will be like a globe or a round one. So this globe, it is known as what? It is, yeah, you are getting correct. It is known as what? It is known as globe thermometer. Globe thermometer. And this globe thermometer, it is used to measure this mean radiant heat. It is used to measure this mean radiant heat. It is used to measure the mean radiant heat. Remember, it is used to measure the mean radiant heat. Next, this is how this sling psychrometer looks like. Sling psychrometer. And this sling psychrometer, it is used to measure the air velocity. It is used to measure this, it is used to measure the air humidity. Just remember. Could you please address me? What is the name of this apparatus? Yeah, you can check here also. It is written. It is known as what? It is known as Horax apparatus. It is known as Horax apparatus, and it is used to estimate this chlorine demand. Chlorine demand, and the indicator we use in a case of Horax apparatus. It is what? It is the starch iodine. It is what? It is the starch iodine. It is the starch iodine. Just remember. Fine. Next one, if you see this image, it's how this fluoroscope looks like. This is how this fluoroscope looks like. Okay, in which you will estimate the level of chlorine. You will just estimate the level of chlorine. Fine. Next, on discussions, you just remember. If it is a one way, if you are dictating, okay, didactic. Remember, didactic means it is a one-way communications. Fine. Whereas Socratic it means it's more philosophical, right? So if it is Socratic, it is a two-way communication. It is a two-way communications. Fine. And you see this one. This is how this sociogram looks like. This sociogram, it is used in a case of. It is made in a case of focused group discussion. Focused group discussion means first who talked, means first who started, then it proceeded with whom, next it went with whom, like that will make this graph. So it is known as sociogram. Remember. Next one, there are unit differentiate between two things. One is this panel discussion and the symposium. Yeah, you are getting it correct. Symposium. Yeah, you are getting it correct. Yeah. In the case of panel discussion, remember, symposium, yes for yes, there will be a specific order. There is a specific order. Okay, there is a specific order. And whereas it is also having this set speech. They will be having this speech known as set speech. Okay, they will be having this set speech. Whereas in the case of panel discussion, it's like a TV panel. So in TV panel, there will be no set. So there will be a no set speech and there will be no specific order. No specific order. And this is how this ORS demonstration which is being shown here. Fine. Yeah, you are getting it correct. Next one, if you see, we'll just see some adult trends. If you see this image, this is how this beautiful. Let's wait for a minute. Let me connect with the charger. Yeah, fine. If you see the next image, you'll be able to see this plant. What is the name of this plant? Yeah, there is no specific. Yeah, correct. If you see this plant, this is what? This is how this Lathyrus sativus looks like. And this Lathyrus sativus, it will be containing this will be containing a toxin known as boa toxin. It is because of this boa toxin. And this leads to this condition known as Lathyrism. Okay. And remember, Lathi means police use their Lathi charge. Like, so this Lathi means they will use this sticks. So there will be presence of this stick stage. Next one, if you're able to see, this is how this flower of Argemone mexicana. Mexicana plant looks like. And this Argemone mexicana plant, it is being adulterated with this mustard oil. It will be adulterated with this mustard oil, sarsuka tel. Okay, and if it is being adulterated, it can result into a condition known as, which condition? Yeah, it can result into a condition known as epidemic dropsy. Okay, epidemic dropsy. Fine. And the toxin which is being responsible here, it is this sanguinary. Sanguinary. It is the sanguinary. Just remember. Next one, next plant, what you able to see this yellow flowers, it is the crotalaria. It is the crotalaria. Just remember. Fine. And this will be responsible for production of this pyrrole alkaloids. And this can result in this endemic toxin. This can result in the presence of endemic ascites. This is epidemic dropsy, and next one it is the endemic ascites. Next one. Could you please identify what is this fungus known as? What is this thing known as? Could you please answer in the comment section? This is known as what? This is known as what? Aspergillus fumigatus. This is not. No, it's not fumigatus. It is Aspergillus flavus infections. Okay, it's also known as the Fields fungus, and this can result. This happens because of the presence of toxin known as aflatoxin, and this can result in a tumor known as HCC. Okay, hepatocellular carcinoma. Fine, just remember. Next we'll look onto this few mosquitoes. If you see this mosquito, this is how our female Anopheles mosquito looks like. And this female Anopheles mosquito, remember, it is a less or S, means it is a sophisticated mosquito. And as it is a sophisticated mosquito, means it will breed in which water? Yeah, it will breed in clean water. Okay, it will breed in a clean water. Fine. And since it's a sophisticated mosquito, as far as it sits with an angle of 45 degrees. Fine. Next one. And since it's a sophisticated, it will be having this single, means it will be having this, it will be laying this eggs as a single. So it will be having this single eggs without siphon tubes. Remember, it is without siphon tubes. And remember, since it's a sophisticated mosquito, and it's a female mosquito, we know it's a sophisticated female mosquito. Females, they are angels. Since females, they are angels, and it's a sophisticated angel, so it will be having the spots on the wings. So it will be having the spots on wings. Okay, as this larvae won't be having this siphon tubes, it will rest parallel to the surface. It will rest parallel to the surface of water. And next, this one is our famous tiger mosquito. Tiger mosquito. Okay, tiger mosquito. Fine. And this tiger mosquito, which is what? Yeah, we're getting it correct. This tiger mosquito, it is what? It is the Aedes aegypti. It is the Aedes aegypti mosquito. And we know it is a tiger mosquito, and it is also known as what? Shameless mosquito. Shameless mosquito. Tiger mosquito, shameless mosquito. Why it is shameless? Because it cannot create something by its own. So it breeds on this artificially collected water. It breeds on the artificially collected water. Fine, just remember. And next thing is that it can result in the diseases which can be remembered by mnemonic, like dry chickens. Fine, dengue fever, Rift Valley fever, yellow fever, okay, chikungunya, and Zika fever. Just remember. Okay, just remember these things about this. Fine, yeah, I forgot these things. Yeah, tiger will produce this cigar-shaped eggs. Fine, cigar-shaped eggs. Thank you, Divya, for remembering. Fine. And next one, if you see, this is how this Culex mosquito looks like. And to remember this Culex mosquito, remember as a pop singer or a hip hop one. And if you remember this hip hop singer, means they will ask you why. So they will ask this Q. So remember, Q in Hindi means why. So this Q for Culex. And these singers, they won't stand and sing. They'll be having this kind of hunchback. So they'll be having this hunchback. And sitting, they will be having this hunchback. And these singers, they won't come alone. They will always come with multiple singers. So they will come with clusters. So they will lay the cluster eggs. Fine. And they will be always dirty. Okay. They will be always either dirty minded or dirty people. So they will be dirty. Okay. It's just to remember the way. It's just a way to remember. Just remember. Yeah, fine. You're getting it correct. Next one, if you see a kind of long legs, if you see a long legs, this will be suggestive of Mansonia. Mansonia. Okay, Mansonia will be having long legs. Along with it, it lays eggs around this pistachia plants. Okay, it lays around this roots of this plants on pistachia plants, and it will lay in a star-shaped clusters. Star-shaped clusters. Okay, fine, remember. And then you need to differentiate between these two vectors, which are the soft tick and the hard tick. Remember, in the case of hard tick, you will be able to see this head, which is seen in a case of hard tick, whereas in a case of soft tick, everything will be soft tick. You cannot differentiate the head from the body. Fine, remember. And to remember this soft tick, you can remember as mnemonic of QRS, means Q fever, and the relapsing fever is seen in a case of it is caused by this soft tick. Yeah. Then next one, if you see this hard tick, it will result in this disease known as Kaysener forest disease and all other tick diseases like Indian tick typhus, tick encephalitis, tick hemorrhagic fever, and tularemia. Tick hemorrhagic fever, Indian tick typhus, and tularemia. Just remember these things. Fine. With this understanding, we'll move on to our next part. Fine. This is how this louse looks like. And we know this louse causes this pediculosis. And for us, this pediculosis, it's like our pet. So remember about this louse as a pet. Okay, pet. Okay. So this louse can result in pediculosis, epidemic typhus. Remember, it is epidemic typhus, relapsing fever, and the trench fever. So remember, it's a pet or a pet. Next one, if you see this type of bug, which is known as this redweed bug, it results in this Chagas disease. And you also know this Chagas disease can be associated with Achalasia cardia. And next one, if you see this fly, it is having this kind of filaments, means kind of hairy things in the wings. This is how this sandfly looks like. And this sandflies, they are like doctors, because doctors will be having a lot of responsibilities, and because of these responsibilities, we cannot fly up by our own. Okay, so we just hop. So this sandfly, they actually won't fly, they will just hop. So this sandfly, this is how it looks, and it can lead to this visceral leishmanias, also known as calazar. Just remember these things. With this understanding, we'll just move on to this biomedical waste. Just remember this yellow one: pus, putty, and plaster. Means if you see any pus or kind of body fluids, or if you see any body fluids soaked bandages, or if you see any plasters that are being used for these bandages, these will be disposed in yellow. And there will be some cytotoxic and even discarded medicine, they will be given in yellow. And also remember this, if it is written empty blood bag also, it is also disposed in the yellow. Fine, I just remember. Yeah, you are getting it correct, Divya. Next one, if you see this red one, remember for a recycling rubber. Okay, recycling rubber. So you will use this rubbers like red rubber catheters, red rubber tubes. You will dispose in a case of red. Whereas white you will use for sharp. Okay. White you will use to dispose this sharp needles, blades, and scalpels. This blue you will use to dispose this broken glass. Okay, it is used to dispose this broken glass. Just remember. Fine. Just remember. With this, we'll move on to the next part, which is about this disaster management. This is just a cycle, and this logo you will remember. In disaster, everyone comes together and they will give their hands to help. Fine. Yeah, you're getting it correctly. Fine. And initially there will be a disaster phase. After that, we'll get response to that. Next one we'll do then we'll do some rehabilitation and then recovery. Then we'll do some preventive measures and mitigation for the next one. Next, we'll be prepared for the next disaster. is how this disaster cycle looks like. Fine. And in a case of disaster, what we'll do is the triage. Okay, fine. And red one, it requires this immediate management, whereas this yellow, they can be delayed. Whereas this green, they are this ambulatory patients. Since they are ambulatory and mobile, you can tell them to wait or come after some time. Okay, or you can take care after a while. And this black one, they are this moribund are the dead patients. Just remember. And one more thing, remember, reverse triage. Reverse triage. In which condition, where you will use this reverse triage? Yeah, reverse triage you will use in a case of war, during a war situation. Yeah, I forgot these things. Thank you, Divya, for remembering. Yeah, the chairperson of this disaster management, it is the Prime Minister. Whereas this nodal officer, the nodal office of this disaster management will be located at this district level. Will be at the district level. Okay? Yeah, you are getting it correct. Fine. Then this is how now a normal distribution looks. Now in a normal distribution, mean equal to median equal to mode. Fine. This is how a normal symmetrical distribution looks like. And you need to remember about this skewness. Where there is a large value, means you need to look at the tail. If the tail is at the largest value, means 10, you just make a graph, 10, 20, 30. If the tail is at the largest value, it means it is the rightward skewation or positive skew. Okay, positive skew or the right skew. In the case of right, and if it is the less than, if it is 10, 20, 30, if the tail is towards the lesser side, it will be what? Yeah, I can use English, but दिक्कत है ना, अगर मैं English में बोल दूँ ना, then like there will be some mismatch. So just that's why I will try to use most of the time English so that it will be comfortable for everyone. Okay, fine. And if you see about these two skews, positive skew and negative skew, or this left skew, just remember of this left skew. If you draw this L, this is how this L looks like, and you can make into V. Means our kind of V, this arrow. If you make this kind of arrow here, this kind of arrow, just remember always the middle one, it is the median. It will be the median one. Okay, this mean will be here and mode will be here. This is the universal one. Like this will be given in your question. Whereas you need to decide which arrow you need to choose. Fine. In the case of left, if you see, the arrow will be, means this arrow will be towards this side. So if you apply this thing to the graph, if you see the mode is the highest one, you can see it is around 23. So mode is the highest value. Whereas median, it is the middle one. Mean, it is around the 20, so it is the lowest value. So same thing applies here. And if you see this rightward skewness, you'll be able to see mean will be the highest one, then median, then mode. Okay, so the mean, if you see, the mean will be the highest one. Okay, yaad rakhna. Fine, yeah, you are getting it correct. Next one, you need to remember just few graphs. If this graph is touching, like if you draw H, you can make this touching graph, which is the histogram. And if you just draw a line over this histogram, it is known as what? It is known as frequency polygon. And if you just draw a curve over it, it is known as what? It is known as frequency curve. Yeah, if you want to know about this SD deviations, just remember the standard deviation of 1, it will be giving, means the most of the values, it will be lying within 68% of the values lie within it. Whereas in a case of standard deviation of 2, around 95% values will be present here. Whereas in a case of standard deviation of 3, it will be around how much percent? Yeah, it will be, yeah, you are getting it correct, Divya, it is 99% of their values. Yeah, fine. Then we'll move on to the next graphs. And in a case of bar graph, if you see, you'll be able to see the distance, and the histogram will be given for frequency. Okay, and there will be a distance of it. So this is how this bar charts look like. And if there is a component within a one bar, it is known as component bar chart. And if it is multiple one, it is known as which bar chart? Multiple bar chart. Yeah, correct. And if you see a line diagram may be having this dip. So this will use to show the trends of event. Sometimes the trends will be high, sometimes this trends may be low. Just remember, this line can dip. Okay, they can come below. They can be negative. Whereas remember, OQ, अगर आप किसी को देते हो तो बढ़ते जाते हो. ठीक है? Or if you share your love or if you share your knowledge to someone, means you will be getting more knowledge and more blessings. So if you give it, it will be increasing. So in the case of OQ, it is a cumulative frequency diagram. So it will be keep on increasing. It won't decrease like your love. Okay, towards medicine. Fine. Next, if you see this one, if you see some kind of scatterings around this curve, it is known as what? Scatter diagram. And if you see a like a kind of pie, it is what? It is known as which chart? Yeah, you are getting it correct. It is known as what? Pie chart. Next, this is how this stem and leaf chart looks like. This is how the stem and leaf chart looks like. And this is how, if you see, you can see it's like a funnel. This is how a funnel chart looks like. And if you see able to appreciate this box along with this side whiskers, this is known as what? Box and whisker plot. Okay, it is the box and whisker plot, and this one is the forest plot. This one is the forest plot. Yeah, you are getting it correct. And next one, it is the iceberg phenomena. Iceberg phenomena, it means it tells you that the presence of subclinical cases. Yeah, it will be telling you about this presence of subclinical cases. And these three diseases won't show this iceberg phenomena. They will be remembered as the mnemonic as MTR or MTR masala. Okay, this MTR one is for measles. T for which one? Yeah, it is T for tetanus. Okay, and R for rabies. Just remember R for rabies. And we know tetanus, we use a media known as Robertson cooked media. Fine, yeah, you are getting it correct. Next one, if you see this maculopapular rash, along with features of conjunctivitis coryza features, along with some kind of lymphadenopathy, it will be suggestive of which condition? It will be suggestive of, and you will be able to see these parts. What is the name of this part? Answer in the comment section. Yeah, you are getting it correct. It is what it is known as what? Coplic spots, and it is seen in a case of measles. It will be seen in a case of measles. Fine, yeah, I was getting it correct. It is known as coplic spots seen in a case of measles. And we studied there is a type of giant cell you will see in the case of measles. What is the name of it? Yeah, it is what it is known as Warthin-Finkeldy giant cells. Fine. And if you are able to see this pleomorphic rash, which is having the appearance of dewdrop on rose petals. Dewdrop on rose petals appearance, it will be seen in a case of chickenpox. And we already saw, if there is some condition, if there is some meningitis associated with the formation of rash, it will be by the Neisseria meningitis. It is by this Neisseria meningitis. Remember this one. Fine. With this understanding, we'll move on to this one. Just a few things you need to remember. This is how a stable looks like. And there is a disease known as dragonculosis, which is actually what guinea worm infections. These guinea worms, they are transmitted by the step cells. So we ban the step cells in India. Just remember. Next one, in the case of which disease, the following organism will act as a amplifying host. It is the Japanese encephalitis. In the case of Japanese encephalitis, the pig acts as a amplifying host. Next, if you see which disease is known as the monkey's disease. Yeah, the monkey's disease, it is the Kaizenur forest disease. And this Kaizenur forest disease, it will be spread by this hard tick. Remember. Fine. With this understanding, we'll move on to our next part. And this just you need to remember, these are this syndromic management by this Suraksha clinic. Fine, to remember this one, remember great girls, just remember great girls wear blue red, yellow bands. Just remember. And just in this point, you need to remember this. It is because of this urethral discharge, and this this one is this cervical or vaginal discharge. These three are this ulcers, and low for lower abdominal pain, and B for inguinal buboes. Okay, just remember B for inguinal buboes. Just remember about this, kids. Okay, don't stress up much. Fine. With this understanding, we'll move on to the next part. If you see this one, this is this 50% rule seen in a case of hypertension. In a case of hypertension, you will be able to see this rule known as 50% rule, means in which entire population, 50% will be suffering. With this 50%, 50% of them they will be diagnosed, and 50% of them they'll be getting treatment, and 50% of them they'll be getting a proper control. Just remember these things. Fine. And this phenomena is known as tracking phenomena. Tracking phenomena. It is seen in a case of BP. With blood pressure, it means like you are getting it correct. In a case, if a patient or if a human, if he remains hypotensive in his adult, he'll remain hypotensive in his old age even. Fine, we just remember. Next one, these are a few logos you need to remember. In the case of National Health Mission, just remember the presence of sun. Next one, PMJ or Ayushman Bharat. Ayushman Bharat, it is the insurance scheme, means in which the 5 lakhs will be given per family, and there is no limitation, no limit of family members. Fine. And this is how this National TB Elimination NTP looks like, and this is how this dots looks like, means there will be a man along with written Pura course and Pakka Ilaj. Next one, this NICT, it is this online portal for this dots. Fine. And Jan Dhan Yojana, you will be able to see this rupee symbol, which is then demonstrating the Dhan and Jan. Okay, about the Dhan means the money. Next, if you see this image, this how this ICDS looks like. And this ICDS, the heart of this ICDS, it is this Anganwadi workers. And this Anganwadi workers, yeah, you are getting it correct. Yeah, I forgot about this Nishchay. This Nishchay, and there is one more thing known as Nishchay. This Nishchay, it is the free UPT kits. It is the free UPT kits. Thank Divya for remembering. Fine. Next one, the heart of this ICDS, it is what? It is the Anganwadi workers. And in this Anganwadi, will give half of the year daily, daily protein requirement, and one third of your daily calorie requirement. Okay, it is given in this Anganwadis. Okay, just remember. Yeah, that's correct. Next, if you see this, how this portion abhiyan looks like, and this portion abhiyan with food, how you will grow, how will grow. It will be like a growing tree. Fine, just remember. Next, this is how this Suman plants looks like. Means on every 9th month there is a free obstetrics check in the private clinics. This is how this Suman plan looks like. Next one, National Family Planning Program, in which you need to put a triangle or a stop to the means excessive family members. So this is how this National Family Program looks like, and this is how this Janani Sishu Suraksha Yojana looks like, where the Sishu and the Janani will get free diagnostics, free drugs, free delivery, and free diet, and free blood transfusions and delivery even. Fine, just remember. Next one is about Anemia Mukt Bharat. In Anemia Mukt Bharat, we follow a thing known as 6x6x6 strategy. Okay, strategy. Fine. This strategy will offer this folic acid and iron tablets for 5 to 9 years old children to pregnant. Till then, will offer them this tablets. Fine. Pregnancy and lactation. Just remember, during your childhood days, whether you are male or female, both of them, they are baby for your mother. So our mother used to choose our dress. Fine. So this mother used to choose our dress from 5 to 9 years. It will be containing, means which will be of these tablets will be of pink in color. Remember, it will be of pink in color. Fine. And it will contain 40 microgram of folic acid and 400 means 40 milligram of iron and 400 microgram of folic acid. Whereas 10 to 19 years and pregnancy and lactating, they will be containing of 60 milligram of iron and 500 micrograms of folic acid. The difference is that, during our childhood, our mother used to pick. So she likes the pink color, she picks. Whereas the boys like the blue color. So from 10 to 9 years, it will be a blue color tablet, whereas pregnancy will use this red color tablet. Just remember. Fine. Next, if you see this protection from the mosquito, it is what? National Vector-Borne Disease Control Program. And we know the most common vector-borne disease, it is the malaria, and the most common viral vector-borne disease, it is the dengue. Yeah, just remember one more thing. Red will intake in a daily fashion, whereas this pink and blue, it will be given for weekly. Okay, it will be given for a weekly one. Just remember. Fine. This is about this National Vector-Borne Disease Control Program. Next one, this narcoviolence. This narcoviolence, if you see this color, this is seen in a case of NACO. And just remember, this in a case of NACO will give this social female like sexual workers. These females will give this FC2 types of condoms, female condoms. Just remember. Then if you see this lotus, it is this National Leprosy Elimination Program, in which will give this three drug regime involving this dapsone, rifampicin, and clofazimine. Just remember these things. Fine. With this, we'll move on to the next program, which is known as Mission Indradhanush. How rainbow has the 7 colors. These also having these 7 vaccines are 7 vaccine preventable diseases. Yeah, you are getting it correct. This includes this BCG, DPT, OPV, hepatitis B, and Haemophilus. Hepatitis B and the measles. Hepatitis, measles, and the measles. Just remember, this is how this Mission Indradhanush looks like. Fine. Next one, there is a program known as the switch. Means in which the trivalent OPV vaccine, it is converted to the divalent one because of this vaccine, because of this P2 derived polio paralysis. Just remember these things. Fine. That's it. This you need to remember about this switch. Fine. And this is how this national program for control of blindness looks like. What is the most common cause of blindness in India? Could you please answer in the chat box? Yeah, in switch we removed the P2. What is the most common cause of blindness in India? Answer the comment section. Yeah, the most common cause of blindness, it is what? It is the cataract. Whereas most common nutritionist cause, it is the vitamin E. Okay, but most common visual error, it is the visual error, means it is the refractive errors. Okay, just remember these things. And this is how this non-communicable diseases program for this prevention of cancer, diabetes, and cardiovascular diseases. Yeah, you are getting it correct. And this is how our favorite Arogya Setu app looks like. And this you also able to see this smiling sun. Yeah, Karthik and Divya, you are getting it correct. Next, you will able to see the smiling sun in a case of iodine deficiency control program. And in this, you need to remember there are 2 levels of iodinization. So they will check this iodinization at 2 levels. So at production level, it must be 30 parts per million. Whereas at the consumer level, it must be 15 parts per million. They means they will double saturate it so that it will be adequately received to the patients. Fine. Yeah. And this is how this National Health Insurance logo looks like. Next one, it is the ESI logo. In this ESI logo, just remember this employer, they pays this higher amount for them. Means they pay how much? Correct. You remember they pay around 3.2% of their salary wages. Whereas this employee, he pays around 0.75%. As a cumulative, they pay around 4%. And there is a sickness benefit. There is a extended sickness benefit and enhanced sickness benefit. In a case of sickness benefit, he will be getting for 90 days, whereas the extended one he will get for 2 years. Whereas enhanced, yeah, remember, I were getting it correct. Enhanced, remember, they will keep the hand and do surgery. So enhanced means it will be given for tubectomy plus vasectomy. And tubectomy, as you told, it will be given for 14 days, whereas vasectomy, it will be given for 7 days. Just remember about this. Fine. With this, we'll just see a few more logos. If you see this IDSP logo, there are 3 peoples. There are 3 forms actually. So they made this 3 peoples. If you see these 3 peoples, one is this. One will be doing this syndromic diagnosis. Then one will be doing this presumptive diagnosis. Next one will be the lab confirmed diagnosis. So SPL. Okay, and the syndromic will be done by this health workers. Whereas this presumptive, it will be done by the doctors. This lab confirmed will be done by the laboratory. Just remember, the SPL one in case of integrated disease surveillance. Fine. Then, if you see this thing, next one you need to remember a few more things. One is this Ujjavala and Ujjala and Ujjvala. Ujjavala means, remember, this Avala means this is this against this child trafficking. This is against this child trafficking. You are getting it correct. Yeah. And Ujjala, remember the brightness of Ujjala. So the Ujjala, it will be for this LED lights. Okay, the brightness of this LED lights. And this one, Ujjvala, it's for the gas. Remember. Next one, if you see, this is how this Ministry of Ayush looks like. There will be a leaves here. Next, means in India, it will means every food products will be assured by this FSSI logo. Okay, and this is how this energy logo looks like. Means it is for this. Yeah, it is for which one? It is for the empowerment for this non-skilled labor. For non-skilled or the unskilled labor. And if you see the next more levels, this Lakshya means Lakshya, it is used to promote or improve the labor room quality. Improve labor room quality. Just remember, this Lakshya means this target, means our Lakshya, means now our Lakshya is to pass the exam. Likewise, this Lakshya is to get these things, improve labor room quality. Next one, that is known as mother's absolute affection. And it is used to improve the breastfeeding. It is used to improve the breastfeeding. Or they promote this breastfeeding. Just remember, it is this or mother's absolute affection. It's to increase or promote this breastfeeding. Just remember this thing. And these are all about this PSM unit. Remember. Fine. Next, we'll move on to the pediatrics. Pediatrics, it will be a short and sweet one. So you don't need to cram a lot of things. Like you just be active, it will be interesting for you also. Fine. And pediatrics, first, what you will be able to see, it is this incubator. Fine. And incubator, what you need to learn, it is that. And in incubator, what you need to learn is that the baby will get heat and how he lost the heat. Just remember, the baby will get heat in a case of incubator. By which mechanism? Yeah, it will get heat by the convection. Whereas it loses the heat by the radiation. Whereas this is how this radiant warmer looks like, which is used to warm the babies. So the baby gets heat and loses heat. The baby will get heat by here because it is radiation, right? So the baby will get heat by radiation, whereas it will lose heat by convection. Fine. Next one. This is how the phototherapy looks like. We know this phototherapy is used for the hyperbilirubinemia in newborn patients. And the main mechanism for this phototherapy is what it is. The structural isomerization. Structural isomerization, by which this bilirubin, which is unconjugated one, will be converted into a component known as lumirubin, and it can be excreted by this kidneys. And sometimes you will be getting confused with structural and the photo because it's a light, right? So you think of photo. Don't confuse it. The main mechanism is structural isomerization, but there are few things which will be happen by this photoisomerization. Fine. Next one. This is a sign known as scarf sign. Scarf sign, which is used to assess this gestational age with the scoring system known as extended Ballard scoring. Fine. And next one. What do you think of? What is this image suggest you of? Just remember, this is how this Pallade feedings looks like. Okay. Why this Pallade feeding is done? Because means like when it is indicated, when it is not indicated. Yeah. If a baby is less than 28 weeks, if baby is delivered very prematurely, then the gut of the baby will be immature. So what we will do is that we'll give just the gut is immature. We're getting it, Divya. Then if the gut is immature, we'll give this total parental nutrition. Fine, we will give just totally parental nutrition. If the baby is between 20 to 31 weeks, then the his gut will be mature. The gut will be mature, whereas the baby cannot accommodate both respiratory and swallowing at the same time. At the time, what we'll do is we'll do this NG feeding. Okay, but if it is after 32 weeks, if it is between 32 to 34 weeks, the baby's gut also will be developed. The gut will be mature, and the swallowing also it can develop. But it cannot do a reflex known as rooting reflex. Means when you stimulate this root of this mouth, it cannot turn and it cannot start breastfeeding. So because of this rooting reflex cannot get developed, we'll use this feeding known as Pallade feeding. Just remember. So there is an absence of rooting reflex. This step we already saw, it is the Shakir step. Okay, just remember. And yeah, you are getting it correct there. If you see this next image, see a text texture image, you'll be able to appreciate this presence of fluids in the lobar fissures. If you see this lobar effusion or the presence of fluids in the lobar fissures, and you'll be able to appreciate some kind of streaking like a sun rays, the sun ray appearance. Because of this collection, we know in a fetal period, you are getting it correctly, right? It is this TTN, transient tachypnea of newborn. Because in a fetal life, our lungs will be entirely filled of fluids. During normal vaginal delivery, the chest will be compressed and the baby will swallow out all of the fluids or cough up all of the fluids. Whereas if you do by cesarean section and if you remove the baby, then if you do cesarean section remove, there is no chest compression. So there is no way of, or there is a less way the baby could get rid of this fluid. So this fluids can accumulate inside the lungs and can cause a transient tachypnea of newborn. So, and it is usually resolved in 72 hours. Just remember. Next one. This is how we see this two arrow. If you see this two arrow, if you are able to appreciate this one inside one, outside one, like a formation of ring, it is known as pneumatosis intestinalis. And remember, it is seen in a case of nectarizing enterocolitis. And mainly, it is seen in a case of nectarating enterocolitis stage 2A. Okay. And remember one more sign, in a case of nectarating enterocolitis stage 2B. In the case of stage 2B, you will be able to see, which thing? You will be able to see the gas in the portal vein. Just remember. Fine. Next, if you're able to see this scaphoid abdomen along with this presence of bubble loops in the thoracic cavity, it will be suggestive of which condition? Yeah, it will be suggestive of congenital diaphragmatic hernia, and the most common one, it is the Bogdalik's one, and it is due to the defect in pleuroperitoneal membrane. Fine, it is due to the defect in pleuroperitoneal membrane. Just remember this thing. Next, if you see this condition, which is what? You can see this acro, means acral lesions. along with this peri-orificial and perianal rashes. Rashes along with this region, it is known as what? Acrodermatitis. Yeah, you are getting it correct. Acrodermatitis enteropathica. Acrodermatitis enteropathica. And this acrodermatitis enteropathica, it happens because of the deficiency of zinc. And just remember, if it's just a different entity, if a baby is presenting with diarrhea means will give supplementation of with the zinc. So if it is less than 6 months, or if it is more than 6 months, they have to, if it is less than 6 months, will give 10 milligram of zinc, or if it is more than, yeah, you are getting it correct. If it is more than 6 milligram, 6 months, it will give 20 milligram. And this is how this kwashiorkor looks like. If you see this belly of a child, like you can see this edema. So in kwashiorkor, you will see this edema. So it is how this kwashiorkor looks like. And you can see this type of dermatosis known as flaky paint dermatosis. You will see this thing known as flaky paint dermatosis. And you're also able to see a sign, one more sign known as flax. Flax means in the hair, if you see this hair, as a hair of this patient, there will be irregular of this black melanin pigments, because there is a different level of the baby's nutrition. So there will be a presence of this flax. Just remember. Next one. If you see this three appearance, if you see this cup-shaped formation known as cupping, and if there is just widening known as splaying, and if just having this thinnish pause known as fraying, and this cupping, splaying, and fraying, these three of them, they are seen in a case of rickets. They are seen in a case of rickets. And we saw in biochemistry that if there is a deficiency of rickets, we are also able to see this ricketic rosary. Next one, this one. If you see this Wimberger's ring, along with this presence of this spur known as Pulcan spur. Pulcan spur, Wimberger's ring, along with this Pulcan spur, it will be suggestive of which disease, which deficiency, and which disease. It is due to this scurvy, which is due to the deficiency of vitamin C. It is due to the deficiency of vitamin C. And sometimes this baby even present to you with pseudo paralysis. Why they will present you with pseudo paralysis? Because you can see some kind of periosteal hemorrhages. Because of this periosteal hemorrhages, the baby couldn't move the limbs, so it can present with pseudo paralysis. Just remember. Fine. Next one. There are few cardiological abnormalities you need to remember. Just if you see this snowman appearance, what you will think of? Answer in the comment section. Fatafat. Yeah, you will see in a case of TAPVC. Fine. You will see in a case of total anomalous pulmonary venous return. Fine. And if you see this sign, if you see this 3 sign, along with this, you see, along with this notching of this inferior border of ribs, notching of inferior border of ribs. This both of these findings, they will be seen in a case of which condition? Yeah, it will be seen in a case of coarctation of aorta. I am getting it correctly. Fine. And if you see this egg on string appearance, this egg on string appearance will be seen in a case of transposition of great arteries. It will be seen in a case of transposition of great arteries. And this appearance, which is known as what? Boot-shaped heart. Yeah, you're getting it. This boot-shaped heart will be seen in a case of tetralogy of Fallot. And in tetralogy of Fallot, there will be 4 components. There will be a large VSD, and next there will be a overriding of aorta, and there will be a infundibular pulmonary stenosis, and there will be a right ventricular hypertrophy. And just remember one more point in this case of tetralogy of Fallot. This severity of tetralogy of Fallot, it will be determined by this pulmonary stenosis. So this severity is determined by this pulmonary stenosis. Just remember. Fine. Yeah. With this understanding, we'll move on to the few more defects. If you're not able to see this complete formation of this cranial cavity, or this cranial wall. So if there is a defect in this cranial wall, it is what? It is suggestive of which condition? Answer in the comment section. Yeah, just remember, it is suggestive of anencephaly, and this will be because of this defect in this which neuropore? Yeah, it will be defect in this, defect in the closure of cranial neuropore. It's around this 25th day. It's around this 25th day. Just remember. Next one. And if you're able to see, there is no neck. There is absence of neck. So it is known as what? Anencephaly. It's known as anencephaly. And if you're able to appreciate a mass near the sacral region, it will be suggestive of this sacrococcygeal teratoma. Sacrococcygeal teratoma. Fine, just remember. Next one, just remember about this gross motor milestone. To remember this gross motor milestones, we know this gross motor milestones, they will progress in a cephalocaudal manner. Initially, there will be head. The baby will lift his head and see. Next, the baby will sit. And just remember, there will be two sit. The baby can sit with support and the baby can sit without support. Remember, sit with support in 6 months and whereas sit without support at 8 months. And if the baby sits, then the baby tries to stand. Okay. And at 9 months, the baby will stand with support. And after standing with support, the baby is try to walk, or then it will try to creep and crawl. So the creep will be starting at 12 months. And if the baby also stands without support. Fine. And at 15 months, it will walk alone. It will start walking alone. And 18 months, it started running. Okay, it will start running. And 2 years, it will go up and down. It will go up and down. And by 3 years, we know it rides tricycle, and 4th year it can hop on a 1 foot. Fine, just remember. This is the 3 years. Means whatever most of the questions it will be asked from the gross motor milestones. Just remember. Fine. Whereas in the case of fine motor, you need to remember 4 months. Initially, there will be a bidextrous approach. Then it will be a unidextrous. And after unidextrous, there will be a immature pincer grab and there will be a mature pincer grab. And by 12 months. 12 months, the baby will run and will be having a pincer grab. Okay, fine. And 18 months, the baby will start scribbling. Fine, just remember. And to remember this, also motor milestones, just remember, by 3 years, the baby can draw a circle. And remember, by 3 years, the baby can draw your face. And sometimes your face won't, sometimes it won't look smile. So the baby will do, means the baby will draw circle by 3 ages. And if the baby won't draw it properly, the baby will cross it. So the baby will learn to cross it. So the baby will cross at the circle by 3 years and cross by 4 years. And after crossing the body, his head, it will be start drawing the body. So this rectangle by 4.5 years, and it can draw this skirt also. Means now it's no like male female how they dresses. So it know how to draw skirts. The skirts, it will be around 5 years. Just remember these things. And later it can draw even this legs like a diamond around the 5 and 5.5 years. Just remember these things about this fine motor milestones. And this about social one, you remember 9 months it waves bye-bye. It waves this bye-bye at 9 months, and 15 months it speaks jargon. There will be no meaning for it. Fine. There will be no meaning for it. Fine. And 18 months, it copies the parent's tasks. For example, if you are washing clothes, it will wash. Okay, if you are writing, it will imitate you. It is known as this domestic mimicry. It is known as this domestic mimicry. Just remember about these things. Fine. Next one. At this language, you need to remember 3 for C. At 3 months, it will coo, like that it will coo. It will start cooing at 3 months. And 6 months, it will use this monosyllables. And 9 months, it will use this bisyllables. 12 months, it knows 1 to 2 words. 12, 1 to 2 words. 18, it means 10 plus 8, 8 to 10 words. Fine. And 3 years, it knows 3 things: name, age, and gender. Okay. And if you're able to remember this much stuff of this milestones, remember, or else just remember about this fine motor milestones and this gross motor one. Like mostly they will be testing in this case only. And if you're not able to remember this much also, don't worry. Just a few things I will tell you. You just try to remember. At 6 months, just remember, 6 months. 6 months, it sits alone. The baby sits alone. And imagine you are someone. When you will sit alone, when you will sit alone, because when you are single. If you're a couple, you will be sitting in couples, right? So sits along with support. Sits along with support or sits alone in 6 months. And if you sit alone, and to whom you will talk? You will talk to your mama and papa. So it will use its ma, pa. Means ma, pa means monosyllables. Monosyllables. And you know the singles most commonly they will work with their hands. Like they will use their hands to text their friends or to share their Insta reels. So they will be having this unidextrous approach. They will be having this unidextrous approach. Fine. Then about the singles, they will tell and they will calm themselves. Like on every day waking up while brushing, they will tell, bro, dude, you are the best. You are the beautiful person in the world. There is no one to match you. That's why I was still single. So they'll be having this way are playing with the mirror known as mirror play. They'll be having this mirror play. Just remember. Fine. 6 months sits alone, monosyllabus, unidextrous approach, and they will do this mirror play. Yeah, you are getting it correct, Divya. Fine. Then next one is about this 18 months. For this 18 months, remember about this 18 years. If you're 18 years, you know, means most of us will be in a home and until 17 or 18, like will be within a line, like we'll be having means demarcation, like we should do this, we shouldn't do this. But after 18, like everything overlaps. So remember, to be within the line, you need to draw the line. So the baby will draw a line at 18 years. And why it's draw a line? Because it want to cross. So at 18 months, it draw a line. Okay, at 18 months, it draw a line and it need to come out. So once it come, how it will come? It will running happily and just going to see the beautiful world. So it will runs and it will start running by 18 months, same 18 months. And when it start running, it came outside. Now it should do some work. It need to study and it means it need to do its household work. Fine. And if it is, since it came outside, it need to do work. So it will build a cube of 2 to 3. It will build a cube of 2 to 3 around this 18 months. Then it went. Then it need to study, right? To start to work, it need to study. So it will be turn 2 to 3 pages. Turn 2 to 3 pages at this 18 months. And after studying, it need to eat and it need to wash the vessels. We studied that domestic memory, how it will washes the plates, how your mother washes. So it is known as what? Domestic mimicry. All of these things will be done at 18 months. Fine. Next one about 3 years. 3 years, remember 3, it's the third alphabet. So it will be a circle. So if you want to get a license, why you want to get a license? During license, they will tell to means just put this 8 on your vehicle. So likewise, this baby child, it want to ride which one? It want to ride the tricycle. It want to ride the tricycle. And since it's a child, right, we cannot tell to put 8. So we'll start from 0. So we'll tell the child to put 0 on the circle. Okay, fine. We'll tell the child to put the circle. Once the child puts a circle, fine, he or she got the license. Now, if she rides a tricycle, if the police catches, they will ask 3 things. They will ask, what is your name? What is your age? And what is your gender? So this child knows 3 things: age, name, and gender by this 3 years. Just remember, if you're able to come up those data, fine. If not, just at least remember these things. It will be enough for you. Okay, fine. That's it. Next one will come for the ENT. Like after ENT, we'll have just anesthesia. And like mostly it will be done before 11 o'clock. Like that's what my plan. Like okay, fine. If you're more fan enough, like we'll take few more times. Fine. Just be active. Just 1 more hour, dude. Don't sleep. Fine. With this, we'll move on to the like ENT part. If you see this ENT one, if you see this first image, what is the name of this year? Could you please answer in the comment section? Josh, I need that energy from the Students, doctors, the doctor's day is going to end. Show your energies. Yeah. If you see this type of ear, it is known as what? It is known as the cauliflower ear. It is known as this. Yeah, ophthalma will be tomorrow. Like there is ophthalma session, it will be of tomorrow. Fine. It is today, it is ENT. Just remember. Fine. If you see this image, it is known as what? Cauliflower ear. Cauliflower ear. And if you see this cauliflower ear, and it is due to because of this pinna perichondritis. And what is the most common organism which is responsible for this cauliflower ear? Could you please answer in the comment section? Yeah, you are getting it correct. Yeah, it is what the most common organism responsible for this cauliflower ear. It is what? It is the Pseudomonas. And we study today only. The Pseudomonas, it will be act by inhibiting this 2 factor known as elongation factor 2. Right. Next one. This is how this swimmer's ear looks like. The swimmer's ear, it is actually what? It is the otitis externa. It is what? It is the otitis externa. Fine. Next one. This is how this surface ear looks like. And the surface ear, it is actually what? It is what? It is actually what? It is the exostosis. It is what? Actually what? It is the exostosis. Because of surfing, there will be exostosis. Just remember. Next one. If you see this one, this is what? This is the otomycosis. Just showing this wet newspaper appearance. Yeah, wet newspaper appearance. You are using those images, like, and it's nice. Yeah, you will be able to see these black pigments. It is because of this Aspergillus niger. It is because of this Aspergillus niger. Fine. With this, we'll move on to the next one. You see a patient along with clinical features of chronic ear discharge, and means you can see some ear piercing might be she. And she's a diabetic patient. So she's having this diabetes mellitus. On examination, you'll able to see this granuloma inside. And what you will think of? You will think of this malignant otitis externa. And just remember, in a case of malignant otitis externa, the most common cause is the same Pseudomonas. And in this, you need to just remember 2 more points. What are these 2 points? Is that for diagnosing this malignant otitis externa, we'll use this technetium 99M bone scan. Okay, we'll use this technetium 99M bone scan. And for prognosis, we'll use this scan known as gallium 67 scan. Let me tell you what does this signifies. Means this, there will be repeated inflammation, right? So there will be a lot of WBCs. So if there is a lot of WBC, means there is a chronic inflammation going on. That you will pick with this technetium 99M, and prognosis will be made by this gallium 67 scan. Fine, just remember. And these are this few otoscopic appearance you need to remember of. And this is how this normal tympanic membrane looks like. Fine. And this place, this tip of this malleus, it is what? It is known as the umbo. And this umbo, it's responsible for this cone of light. And this cone of light, it's most commonly seen in this anterior inferior quadrant. And we know with this we can decide whether it is a right ear or a left ear. And if you draw a clock, and if you write the letter as R, you can see at 7 o'clock, if you see this cone of light at 7 o'clock, it will be a right ear. Okay, 7 o'clock means it is a right ear. Whereas in a case of left ear, you will see at 5 o'clock position. Yeah, you are getting it right. Oh, yeah, sorry. Right, you will be able to see at the 5 o'clock. Whereas left, you will be able to see at the 7 o'clock. Fine, you will be able to see at the 7 o'clock. Yeah, fine, just yeah. Sorry for this. Next, if you see this bony projections more prominently, this will be suggestive of retracted tympanic membrane. It's mostly because of eustachian tubular obstruction. This will result in the retraction of the tympanic membrane, and it will produce as type C graph in tympanometry. I will show you this type C graph. Fine. Then we'll move on to the next one. If you see this one, this is how this perforation perforation of tympanic membrane looks like, and this is also the perforation. Dude, what is the difference? The difference is that if you see this perforation, you will be able to identify this perforation will be having this irregular margins, and you can see some blood clots even, irregular margin along with presence of blood clots. It will be suggestive of which condition? Yeah, it will be suggestive of this traumatic tympanic membrane rupture. And we know for management of this, it is what? It is just the conservative management. We don't do anything. Okay, we don't do anything. I was getting it right, Divya. Fine. Next one. This is how this instrument known as grommet, which is being inserted. Like most commonly, it is inserted in a child who is having these clinical features of typical adenoid hypertrophy along with this conductive hearing loss. Just remember. Fine. Next one. This is how this. I've seen this image. This bulged out tympanic membrane because of this pus behind it, and you can see this blood vessel. So it is showing this which appearance? This cartwheel appearance, and it is seen in a case of acute suppurative otitis media. And if you see this pink color, sign, behind this intact tympanic membrane, especially this flamingo pink, seen behind the tympanic membrane, it is one of the Shawat sign, which is seen in a case of otosclerosis. Which is seen in a case of otosclerosis. And this Shawat sign, it will be suggestive of this flamingo pink sign. It will be suggestive of an active disease. Remember, it will suggest of an active disease. And like we know, this otosclerosis, it can be aggravated. Mostly, it will be aggravated during which one? It will be aggravated during, it will be aggravated during the pregnancy. And we know it is a autosomal dominant one, and it involves this bilateral ear. And if you see some kind of active disease, we'll use this sodium fluoride. We'll use this sodium fluoride for their treatment, for their management. And next one, if you're able to see the presence of whitish membrane behind this intact tympanic membrane. If you see this type of whitish membrane behind this intact tympanic membrane, whitish mass behind this intact tympanic membrane, this will be seen in a case of congenital cholesteatoma. This will be seen in a case of congenital cholesteatoma. Just remember these things. Fine. Next one. Then, if you're able to see this thing, you may confuse it with short sign, but don't confuse it. There will be always a history. If you see, there is a history of pulsatile tinnitus, along with sometimes there might be a bleeding. And both of them, it will be suggestive of this tumor known as glomus tumor. There might be of two types of glomus tumor. One might be of glomus jugulare or tympanicum. Mostly glomus tympanicum will be having these features. Fine. And this type of sign, it is known as what? Rising sun. Yeah, you are getting it correct, Divya. It is known as what? Rising sunset. It is known as rising sun. Just remember, it is known as what? Rising sunset. Next. Then we'll see about few PTA images. We see about some PTA images. This is how a normal PTA looks like. Both air conduction and bone conduction, both of them, they are normal. Air conduction and the bone conduction, both of them are normal. And if you're able to appreciate a gap between this bone conduction and the air conduction, it is known as what? Air-bone gap. And it will be seen in a case of conductive hearing loss. Fine. Whereas in a case of sensory neural hearing loss, the sensory neural hearing loss, both of them, they will be down. In a case of sensory neural hearing loss, both of them, they will be down. Like in such cases, like here, like it's I didn't given the sensory neural hearing loss. Like in these cases here, the both of this air conduction and bone conduction will drop in a case of sensory neural hearing loss. Whereas if you see, there is a drop in this both sensory and neural, and there is a drop in this both graphs, like AC graph and BC graph, but you will still able to see this AB gap. It will be suggestive of a mixed type of hearing loss. Okay, fine. Next one, if you're able to see a dip at the 4,000 Hz, if you're able to appreciate this dip at the 4,000 heads. Which disease you will see this dip at 4,000 heads? Could you please answer in the comment section? You will see in a case of noise-induced, you will see in a condition known as, you see in a case of noise-induced hearing loss. Okay, and this type of notch, it is known as what? Boyer's notch. Okay, it is known as what? Boyer's notch. Next one, if you see a dip, if you see a dip at just 2,000 heads, 2,000 heads means only they are conduction dip. So if you see a dip at 2,000 heads, it will be suggestive of otosclerosis. And this one is known as Cahart's notch. It is known as what? Which notch? It is known as what? Yeah, you are getting correct. It's known as Cahart's notch. It's known as Cahart's notch. Just remember. Fine. With this understanding, we'll move on to the next investigation, which is what? Which is the tympanometry. In tympanometry, this is how this normal A type of graph looks like. Normal A type of graph looks like. And next one, if you see this type of same type of A graph, but it is localized this side, this will be suggestive of this type C1. This type C type of graph will be seen in a case of eustachian tubal obstruction, okay, or retracted tympanic membrane. And this AD type of graph, which is seen in a case of, means the distant graph will be seen in a case of like distorted ear ossicles. Fine. And this type B will be seen in a case of glue ear. Means if there is any presence of fluid inside the ear, it will produce this type B graph. Fine. That's it about. And next, this because of this otosclerosis, this ossicles they get fixed. They couldn't move, so they will produce this movement to the tympanic membrane with a less movement. Okay. So they'll produce this smaller one. So this smaller one seen in a case of otosclerosis. Okay, this AS will be seen in the case of otosclerosis. Just remember, it is seen in the case of otosclerosis. Fine. And this is how this typical type C graph looks like, and it will be seen in the case of eustachian tubal obstruction. Fine. Next one. If you see the next method, you'll be able to appreciate it's a method which is used for, or it's a procedure which is used for diagnosing this. Could you please name this test? Or name the maneuver? It is known as Dix-Haplick maneuver. And this maneuver, we know this will use to diagnose this BP, benign paroxysmal positional vertigo. Just remember, this is our Dix-Haplick maneuver. This is our Dix-Haplick maneuver, and it is used to diagnose this benign paroxysmal positional vertigo. Next one, if you see, and this Dix, it will be containing of how many steps? It will be containing of 2 steps. Just 2 steps. We'll just relocate this otoconia and we'll just elicit this vertigo. Next, if you see this 5-step procedure, which is known as this Epley's maneuver. You see this Epley's maneuver, this is a 5-step one. Okay, and it is used as a treatment for benign paroxysmal positional vertigo. Just remember these things. Yeah, you are getting it correct there. Next one. If you see this type of sign, which is known as this battle sign. This battle sign you will see in a case of middle cranial fossa fracture. And this test, it is known as what? It is known as this Cottrell's test, which is used to relieve the nasal obstruction. Okay, it is used to relieve this nasal obstruction to check this DNS level of obstructions. Fine. And if you see this target sign, and this filter paper, this will be suggestive of which rhinorrhea? It will be suggestive of traumatic CSF rhinorrhea. It will be suggestive of traumatic CNF rhinorrhea. And we know the gold standard for diagnosis of this is the beta transferrin. This is the beta transferrin. And we know, and next one, if you draw a line between this medial canthus, to this angle of jaw, it is known as what? Holmgren's line. It is known as what? Holmgren's line. And this Holmgren's line, and this Ogren's line, it is used to assess this prognosis of maxillary carcinoma. Okay, it is used to assess the prognosis of maxillary carcinoma. Just remember, fine. Next one, if you are able to see this ironed out mastoid, it is seen in the case of which condition? Just remember this. Yeah, you are getting it correct. This ironed out mastoid, it will be seen in a case of acute mastoiditis. Acute mastoiditis. Next, if you see this bilateral ice cream cone appearance, if you see this bilateral ice cream cone appearance on contrast enhanced MRI, it will be seen in a case of vestibular schwannoma. It will be seen in a case of vestibular schwannoma, and it will be associated with syndrome. Yeah, we discussed, like it will be associated with this NF2 syndrome, and it will be associated with the chromosome number 22. Fine. And this is how the CT, because for air anywhere we use the CT. You can use this. You can see this air-filled mastoid cells. Fine. So, but here, because of this inflammation, inflammatory fluid accumulates, so that you couldn't appreciate this air cells very clearly. Just remember. Next one, few instruments will look on. This is how this seagull's speculum looks like, and this seagull speculum, it is used for seagullization, or we do the fistula test. So it is used for seagullization and sometimes magnifications, and we can drop some drugs also with this, but now we are not using for drugs. Fine. And this probe, could you please answer me, what is this name of this probe in the chat box? Yeah, doctors, you are getting it correct. It is known as what? Jobson-Harney probe. This Jobson-Harney probes will put and will try to extract any foreign body in the EAC. Okay, we'll use to remove any foreign body in the EAC. Fine, remember. And next one, if you want to see, this is how this auditory brainstem implant looks like. Why we do this? Because if you see in a case of this NF2 associated vestibular schwannoma, the patients will be having this bilateral neural involvement. If there is a bilateral nerves which are being affected, we cannot give any hearing aid. So in such conditions, we'll use this implants directly into the brainstem. So it is known as auditory brainstem implant. Next one, this is how this BAHA looks like. Means, for example, in few conditions, if there is a presence of this exoacoustic meters or this pinna, we can hang this hearing aid. But if there is any absence of this whole pinna or absence of this EAC atresia, we cannot hang this hearing aid. So in such cases, we'll anchor this hearing aid to the bone. So it is known as bone anchoring hearing aid. Okay, fine, just remember. Next, these are the two forceps you need to remember. But you'll get confused which forceps is what. Just remember, it is Walsham's forceps. Remember, Walsham forceps, it's a straight one. If you draw W, you'll be able to see this. Everything is straight here, right? So if you see a straight one, and if you are able to see this one, which is a non-traumatic side, and this one, it is what? It's the Walsham forceps. Remember, this will be used to reduce, this nasal bone fracture. It is a nasal bone fracture. Whereas this Ash forceps, which won't be a straight one, which will be used for this septal deviation correction, which will be used for this septum. Fine, just one. Next one, this is how this laryngoscopy which is being done. We'll see this laryngoscopy in anesthesia also. And this is how this indirect laryngoscopy. And for this, we'll use this straight mirror. Fine, you just remember, we'll use this straight mirror for this indirect laryngoscopy. And this indirect laryngoscopy, it is OPD procedure. You come, we'll put a indirect laryngoscopic mirror, and we'll see the larynx. We'll just tell them to phone it even, and we can see the movement of this vocal cord. So this is a OPD procedure, but the disadvantage is that we cannot see. For example, this anterior commissure of vocal cords. Fine, we cannot see this anterior commissure of the vocal side. Next one, this after total laryngectomy, we will use this process known as Bloom-Singer prosthesis. Bloom-Singer prosthesis. Fine, we use this prosthesis as Bloom-Singer prosthesis. Or this, we can use this also known as electrolarynx, which electrolarynx. Electrolarynx. Just remember. Fine. Next one, we'll just see some laryngoscopic views. This is how this normal vocal cord looks like. We know this normal vocal cord, it doesn't have a blood supply. So it will be pale in nature. And remember, it doesn't have a blood supply, and it also doesn't have no lymphatic supply even. Just remember. Okay. And this is how a normal vocal cords looks like. And if you see a kind of bilateral vocal cord lesions, okay, if you see this bilateral vocal cord lesions, which will be between anterior 1/3 to the posterior 1/3, mostly it is a bilateral one, and this will be suggestive of this vocal nodules, also known as singer's nodules, screamer's nodules, or this teacher's nodules. Okay, so for this management, well, it is also a conservative management. We'll give this PPI and the voice rest. Whereas if you see a unilateral mass, okay, it will be suggestive of this vocal polyp. It will be suggestive of which one? It will be suggestive of this vocal polyp. For this, we'll do this microlaryngeal surgery. Just remember. Next one. This is how this omega-shaped epiglottis is happen because of this laryngomalacia. And if you're able to appreciate this, mouse nibbled appearance of vocal cord. This mouse nibbled appearance of this vocal cord, it will be seen in a case of TB of this vocal cords. Fine, remember TB of the vocal cord. And remember one more thing: the first sign of TB vocal cord, it is this hyperemia. Means the vocal cord will become red. We know it is usually pale, but if it becomes red, you can think it might be of TB. And if you see this multiple lesions around the vocal cord, it will be suggestive of juvenile papillomatus of the larynx. And the variants which is being responsible for it is the 6 and 11. It is the 6 and 11. Remember these two things. Fine. With this, we'll move on to some outpoaching structures. Fine. These outpoaching structures, if you want to remember, if you see a cystic swelling, on X-ray, you will see black, which means it contains air. So air-filled cystic swelling around the lateral aspect of the neck. Along with this, there will be a history. What is the history? There will be a history of that trumpet blowers or some glass blowers. So this blower's history, okay, this blower's history, it will be suggestive. It will be suggestive of which thing? It will be suggestive of this laryngoscope. Okay, it will be suggestive of this laryngoscope. Next one, if you see this one, if you see this outpoaching structure on the back side, and this seen on this barium swallowing, it will be suggestive of which one? It will be suggestive of Zenker's diverticulum. And we know this Zenker's diverticulum, it most commonly occur between this oblique thyropharyngeus muscle, means thyropharyngeus, and this cricopharyngeus muscle. Okay, that will be area known as Killian's dehiscence. Okay, Killian's dehiscence. Just remember this thing. Fine. With this understanding, we'll move on to the next one. This is how this proper adenoid faces looks like, where you will see this pinched nose, like vertically elongated face, along with this crowded teeth, and this high arched palate. It will be seen in a case of adrenal hypertrophy. Fine, just remember. Then this is how this juvenile nasopharyngeal angiofibroma looks like. They'll be having this history of recurrent epistaxis. Fine, and we know what is the most common artery which is being responsible for epistaxis in a case of juvenile nasopharyngeal angiofibroma. Remember, the most common artery here also, it is the most common artery responsible. It is this palatine artery. And because it is also origin from the, it will get origin from this spinopalatine foramen. Spinopalatine foramen. And it can result in the deformity known as frog face deformity. Frog face deformity. Just remember. Next one. If you're able to, means in the case of JNE, if this posterior, this tumor pushing this posterior wall of this maxillary atrium, this is known as what? Antral sign. Antral sign. Okay. And there is also one more sign. If there is a widening of this foramina, it is known as what? Holman-Miller sign. Antral sign or this Holman-Miller sign. Both of them they are seen in a case of juvenile nasopharyngeal angiofibrosis. Fine. Next one. If you see this edema, if you see this edema over this uvula, it is known as which edema? It is known as this Quincke's edema. Whereas quinsy, it is the peritonsillar abscess in which it pushes this tonsil. It will pushes this tonsil to opposite side. Okay. Whereas this is how this parapharyngeal abscess looks like. This parapharyngeal abscess. The difference is that here there will be a abscess, but this thing, this uvula, it will be in a center. It won't be pushed to other side. It will be in a center. And remember, here there is a external swelling also will be present in the case of parapharyngeal abscess. And if you see this widening of this prevertebral space, it will be suggestive of retropharyngeal abscess. Fine, retropharyngeal abscess. Then if you see this kind of thing, this is how this hypertrophy of this sebaceous glands, it is known as what? Rhinophyma. Also known as this potato nose. Also known as which nose? Potato nose. And if you have a history of an examination, you are seeing a roomy nasal cavity along with formation of excessive crusts. Roomy nasal cavity along with formation of excessive crusts, nasal crust, along with the anosmia known as merciful anosmia. Will be suggestive of which disease? It will be suggestive of a disease known as Oziana, or also known as atrophic rhinitis, also known as atrophic rhinitis. Remember, and if both of these conditions coexist together, it is known as what? Rhinosclerosis. And this rhinosclerosis, and it can lead to the deformity in the external nose. Under microscopic appearance, you will be able to see these two bodies. You will be able to see these two bodies in a cells known as Miculus cells and the Russell's bodies. Miculus cells and the Russell bodies. Okay, fine. You just remember these two things. Next, if you see, there is a history of trauma. And if you see, you're able to appreciate this bilateral swelling in the nasal septum. It is because of this nasal septal hematoma. Okay, hematoma. And this is how we saw this previously in the microbiology. This is how this rhinosporidiasis looks like. Rhinosporidiasis looks like. Fine. Next one. To remember this Leafoot fracture, remember Leafoot's type 1. For remembering this type 1, it is at the level of palate. So remember, keep your one hand here. So this is this. If it is above, below, just one transaction, it is what? Leafoot's type 1. And if it is type 2, keep your two hands. And it is a triangular fracture. If it is a triangular fracture, or craniofacial distinction. Okay, this is what? This is the Leafoot's 2. And in Leafoot's 2 and 3, yeah. And in Leafoot's 2 and 3, you will be able to appreciate this presence of CSF rhinorrhea. And there are two types of nasal septal fracture. If you see this chevrolet one, it is a vertical one. Means you will see this 2L, so it is a vertical one. Remember, it is a vertical one. I am getting it correct. Next one, if you see this Jargway fracture, it is a horizontal one. Okay, it is a horizontal one. And we know the most common fractured bone in the nose, in the face, it is the nasal bone. In the face, it is the nasal bone. Just remember this one. Fine. Next, we see some kind of paranasal cells. These paranasal cells, there are different types of paranasal cells. If it is in relation to this orbital floor, then what is the name of these cells? It is what? It is known as what? Heller cells. Heller cells. Okay. And if it is in relation to this optic nerve, it is known as what? Optic nerve. Then it is what? It is known as what? Onodi cells. It is known as onodi cells. And if it is the anterior most, this anterior most ethmoidal cells, the anterior most ethmoidal cells, they are known as what? Agar-Nassae cells. Agar-Nassae cells. Okay. And just remember the most consistent cell of this ethmoidal region, it is the bulla ethmoidalis. Bulla ethmoidalis. Most consistent one, it is the bulla ethmoidalis. Just remember this. Fine. With this understanding, just remember this few more views. This views, which is this occipitomental view. This occipitomental view, it is known as what? Caldwell's view. Caldwell's view. And we see there are two more views: Waters view and Pierce view. This is how Pierce view looks like. This is how Waters view. Waters view looks like. Just remember, means Waters view we most commonly use for this maxillary sinus. Caldwell view will most commonly use for frontal sinus. Okay. Just remember, to hold your water, means hold water inside your mouth, you need to close your mouth. So this closed mouth view, it is known as this Waters view. Whereas this open mouth view, it is known as this Pierce view. Just remember, just try to differentiate. Waters view, it is the open mouth view. Fine, just remember. Then we'll move on to a few other conditions. If you see this rising sun epiglottis along with this thumbprint sign, both of them, they will be suggestive of which condition? Just remember, both of them will be suggesting of this acute epiglottitis. Remember, both of them, they will be suggestive of this acute epiglottitis. And we know that now the most common cause is the Streptococcus pneumoniae, or this Streptococcus species. And if you see this steeple sign, and it is because of this, which one? The steeple sign, it is because of this acute tracheobronchiolitis. And it is most commonly caused by this para-influenza virus. Just remember. Fine. With this understanding, we'll move on to the next slide. These are just these few tracheostomy tubes. This is a cuffed one, uncuffed one. This uncuffed one, it's used for children. Fine. So both of them, they are PVC tubes. Adult. Both of them, they are PVC tubes. Both of them, they are PVC tubes. Just remember. And for long-term tracheostomy, we use some metallic tubes. For example, if you use a complete one, it is known as Jackson tube. Okay. Just remember, Jackson is a complete dancer. So if you see this complete tube, it is a Jackson tube. Whereas if you see this Patava tube, also known as, if you see some kind of incomplete tube, unlike a F-like fissure there, so it is known as what? Fuelless tube. It is known as what? Fuelless tube. Just remember these two tubes about it. Next one. To remember about this foreign body, you can remember like how you know. In the front radiograph, the full con view, it is what? It is in the foot pipe. It is in the foot pipe. Whereas you can also remember esophagus. Esophagus. In this esophagus, if you write this word esophagus, you will be seeing or reading it from anteriorly. So in anterior posteriorly, you will be able to see this AP view. You will be able to see this complete view. Just remember. Fine. This is about this foreign bodies. Next one will come into the facial nerve palsy. We know the most common type of facial nerve palsy is the Bell's palsy, and it is a lower motor neuron damage. And it is a which damage? It is a lower motor neuron damage. And remember, in the case of Bell's palsy, it will most 80% of this Bell's palsy, it will resolve by its own. Fine. In a case of Bell's palsy or in a case of facial nerve palsy, you'll be having these features like there will be a loss of wrinkles in the forehead. There will be no wrinkles in the forehead, and there will be wide opening of this eyes. The eyes will be open so that the patient cannot close this eyes. So the patient will be having this exposure keratitis. Okay, and there will be there will be loss of this nasolabial fold, and there will be a drooping of this mouth to the opposite side, drooping of this mouth to the opposite side. Just these are the suggestion of Bell's palsy, and it is a lower motor neuron lesion. And in a Bell's palsy, usually it will resolve. Will give some steroids and acyclovir for them. And if you are able to see this presence of these vesicles along with this facial nerve palsy or this Bell's palsy, it will be suggestive of which syndrome? We'll be thinking of which syndrome? It will be thinking of Ramsay-Hunt syndrome. And this, we know it is due to the reactivation of this varicella virus reactivation. Fine. It's due to this varicella virus reactivation. Next one, if you see this tip of this nose involvement, it will be seen in a case of zoster ophthalmicus. Because of this involvement of nasociliary nerve. Because of this involvement of this nasociliary nerve. Just remember this one point about this herpes zoster ophthalmicus. Just one, fine. These are all about ENT. Next, we'll move on to the anesthesia. Anesthesia, it just exactly take 10 to 15 minutes. Just sit back, relax. Fine. We'll be done with the session. Just go home and have a dinner. Fine. Fine. This anesthesia, we'll start with this airway. Could you please name this airway if you're active enough? Start. This is known as what? This is known as this Goodell's airway. This is known as this Goodell's airway. And this Goodell's airway, it is used to prevent your tongue to falling back. So in a case of unconscious patient, you might be intubated. So to prevent this falling back of this tongue, so we'll use this airway. So it will prevent back falling of tongue. Just remember. And this is how this laryngeal mask airway looks like. Means in few conditions, there is no need of doing intubation, ET intubation. This is very traumatic, right? So we'll just go above the larynx. We'll just keep this laryngeal mask airway, and after the procedure, we'll just remove it from superiorly. So most commonly it is used for this daycare procedure, and the induction agent will use for this LMA insertion. It will be propofol. Induction agent for LMA insertion. It is the propofol. And this LMA, there is one more variant known as LMA Procil. This LMA Procil, the advantage is that this LMA, they can prevent aspiration. Okay, they can prevent aspiration. So what they did was they added just one more tube so that we can put this nasogastric tube. That's it about this Procil. Why it's prone? Because it can pass this nasogastric tube. Okay, that's it. Next one, this is our favorite ET tube look like. And this ET tube, you need to remember that the resistance of this ET tube. The resistance of this ET tube, it's because of its diameter, not because of its length. And here you will be able to see this eye. It is known as which eye? Whose eye? It is known as this Murphy's eye. This Murphy's eye, it will produce this. It will be used as an alternative for airway and for suction. Just remember, this is the Murphy's eye, and this is where the bullet where you will inflate this cuff. It is a cuffed ET tube. Cuffed ET tube, remember. And if you see able to see two cuffs and the two pathways, means two lungs, they are ventilated separately. This is known as what? This type of tubes, they will be most commonly used in a case of this surgeries, like for example, thoracoscopic surgeries. They'll be used in a case of thoracoscopic surgeries. Fine. Next, if some cases, if you are doing some surgeries in a prone position, then what will happen is sometimes you are unable to, means your ET tube will get kinked. So if it get kinked, means there will be no airflow. So to prevent this kinking, we'll use this tube known as flexometallic tube, which is actually which is kink is. If you kink also, there will be no problem with this tube. Just remember. Fine. And this is our favorite laryngoscope, how it looks like. And there are two varieties. One is Macintosh C for curved And who needs curves? Who needs their body shapes? Our adults. Our adults needs their curves and body shapes. Whereas this Miller one, it is a straight blade. It is this straight blade one. Just remember. Fine. Next one is our Mallampati classification. Just remember, if it is Mallampati class 1, you will be able to see the tip. If it is a first class, you'll be able to see this tip of uvula and this fossil pillars. Whereas in a 2, you won't be able to appreciate the tip and fossil pillars. Next one, in a case of 3, you won't appreciate the uvula itself. Okay, you won't appreciate the uvula itself. You will just see this soft pellet and the hard pellet. Whereas in the case of class 4, you will just see this hard pellet. You will just see this which pellet? You just see this hard pellet. Fine. Next one. Okay, there is one more class. There is 2 more class actually. The class 0, you just need to remember, if you're able to see the tip of epiglottis. Just remember, if you're able to see this tip of epiglottis. Yeah, I just forgot to remember. This one is the double lumen. Is the double lumen ETT. Is the double lumen ETT. Just remember. Fine. Next, there are few needles you will use for this anesthesia. This one, it is what it is. This our Q-Heiss needle. It is our Q-Heiss needle. This Q-Heiss needle, you will be able to appreciate like this. How we study flag sign in a case of Kwashiorkor. You will be able to appreciate there is a blackening, whitening, blackening, and whitening. So this is what this is the Q-Heiss needle, and it will be used for epidural anesthesia. Whereas this one, this Pinkies, Vitake, and Spotty needles, they are used for epidural anesthesia. Yeah, Diva, you are getting it correct. Fine. And just remember the most common complication. Sorry, it's not epidural, it's spinal. Spine. The most common complication of spinal anesthesia. It is what? The most common complication of spinal anesthesia. It is what? It is not the headache. Don't confuse this. The most common complication of spinal anesthesia is what? It is the hypotension. And remember one more thing. Most common post of complication. Post of complication, it is what? Urinary retention. The urinary retention. Fine. And finally, you'll be able to see if you applied epidural anesthesia. So now you want to make it spread. Then you will do this position known as Trendelenburg position. Just remember, this is how this Trendelenburg position looks like. And if you tilt in opposite side, it is what? Reverse Trendelenburg. In Trendelenburg, the head end will be on the downside. Yeah, you are getting it correct again. Fine, that's absolutely awesome. Fine. If you say this next cream, it is what? EMLA cream. This EMLA, it will be containing butyric mixture of lidocaine and prolactin. And this will be having this, it will be used for this topical anesthesia, and it will produce side effect known as hemoglobinemia. And next procedure which is being done here, it is what? It is the intravenous regional anesthesia. And for this, our systolic BP of upper limb must be, it will be like systolic plus upper limb BP of 50 and lower limb of 100. Okay, 100. Just remember these things. IVRA, intravenous regional anesthesia, and it is contraindicated in sickle cell anemia and any peripheral vascular diseases. Next one, this milkish white liquid. It is what? Yeah, you are getting it correct. It is what? It is the propofol. It is what? It is the propofol. Fine, it is the propofol. And next image, like they will ask you like which type of mask, how much FiO2 flow. This is how a high flow nasal cannula looks like. In this, you will get a FiO2, and this oxygen delivery will be means 45%. So you will get a maximum FiO2 of 45%. Whereas the simple Hansen mask, you will get up to 0.6, means are 60% of this FiO2. Whereas this Ventry mask, you will be able to identify with these structures. This Ventry mask, will be able to get up to 0.6%. This anesthesia marks can deliver up to 100% of oxygen. Okay, means FiO2 of 1%, which means 100% of oxygen. Remember, so this is what, this is the anesthetic mask. And sometimes with this normal mask, you can get up to 90% of oxygen or FiO2 of 0.7 with adding this bag known as reservoir bag. Okay, if you add this reservoir bag, you will get up to 0.9%. That's your. Okay, these are about this few masks you need to, and its flow in the graph. Next one, if you see, is how this ambu bag looks like. Okay, and it is contraindicated in which condition? Remember, it is contraindicated in congenital diaphragmatic hernia. This is our powder inhaler, also known as rota inhaler, looks like, and this is how this metered dose inhaler looks like. This is how this metered dose inhaler looks like. And to remember about this cannula, just remember about this grass. After 18 years, you will get a grass will be green. After 18 years, you will get a which signal? You will get a green signal for most of the things. You will get this green signal. Or else you can remember, girls always believes they will be only within 20. So 20, it's 20 gauge, which is a pink color. It's a pink color, means the girl's favorite color. So the girls thinks they will be always within this 20. Fine. So just remember 20 gauge for this pink, for this girls. Okay, girls. Just remember. And rest, you know, if there is a plant of green color, it will lay a pink flower, and there will be a blue sky, there will be a yellow sun and a wild galaxy, and below there will be a soil and a lava. Fine. Next one. This is how this cricothyroidotomy is being done. If you see this is the thyroid cartilage, this is the cricothyroid, and if there is any tube which is being inserted here, it is known what it is. This cricothyroidotomy tube. Don't confuse it with the tracheostomy tube. We know this tracheostomy tube, we will insert mostly between this second to third tracheal rings. Okay, second to third tracheal rings. Remember, okay, it is what usually we do. Fine. This is how this tracheostomy tube looks like, and it is a cupped one. We know in adults we'll use this cupped one. In the case of child, we'll use this uncupped one. This is how this cricothyroidotomy looks like. Fine. Just remember this. And this is this anesthesia machine, which is named as this Boyle's machine. Right? Just remember, just one thing. There are three different circuits. Just remember, this high flow circuit will be consisting of this yoke valve assembly, and emergency oxygen flush. Just remember this one point about this Boyle's machine or this anesthesia machine. Fine. With this, we'll move on to the next part, which is the capnography. Capnography, it will identify this carbon dioxide from our expired air, and it's correct. This capnography, it will become this fin shape. This fin shape in the case of partial obstruction or because of bronchospasm, where this capnography will become line or will become zero when there is a complete bronchospasm or esophageal intubation. That's remember, or in the case of esophageal intubation. These two conditions, this capnographic graph will become flat. Okay, fine. And next one, what is this index you will use to monitor the depth of anesthesia? To monitor the depth of anesthesia, we'll use this index known as bispectral index, and you will use this index known as bispectral index. Next one, this nerve monitoring during anesthesia, this most commonly is done with which nerve? Just remember, the most commonly it is done with the ulnar nerve. Ulnar nerve means it is this nerve monitoring. This is the nerve monitoring. Question. Next one, this anesthesia circuit. These are actually what they are. These circuits, they are semi-closed circuit. Means this circuit, they will tend to give their flow to the outside environment. Means to differentiate this A1 means in a case of Mapleson A, just remember this expiratory valve, it will be near to the patient, or this expiratory valve it's above the patient. So in the case of Mapleson A, it is also known as Muggle circuit. It is used for it is used for spontaneous ventilation in adults. Whereas Mapleson D, BC, it is a Gali, so we won't use these circuits anymore. Whereas this D, Mapleson, yeah, we're getting it correct. Yeah, Mapleson D it is also known as brain circuit. It is used for controlled ventilation. Remember CD. Next one, Mapleson E. Why it is E? Because it will be having everything except the balloon. Okay, so there will be no balloon. So it is known as IST piece. It's just a T piece, bro. There is no any balloon attached to it. Fine. Yeah, you're getting it correct, Divya. Thank you for being active. So it is a bagless one. It is a bangless one. And it is a valveless one. There is no bags also. There is no valves also. Fine. Next, you can see this next circuit, which is known as this Mapleson F circuit. This Mapleson F circuit, also known as this Jackson-Reeves modification. It's also a Jackson-Reeves modification of the E. What he did was, means E there is present everything except balloon. He added a balloon here in the pathway. So if they add a balloon, it is Mapleson F, which is used for the pediatric patient. This time it is used for this pediatric patient. Fine. And finally, means I think so. It's the end slide. Finally, it's our end slide. The final slide. Yeah, welcome to it. If you see this slide, means if you see a black cylinder with white shoulder, will be seen in which gas will be having these features? Yeah, it will be seen with oxygen. Oxygen cylinder will be having this one. COVID times you will be knowing. Next one, Enternox. Before Enternox will come to this one, blue, Neela color cylinder is in Neela or Neelam. Which is actually what? It is a blue one. So this blue one will be for this nitrous oxide. It's the laughing gas. Next one, the cyclopropane uses this orange one. See, you will can make an orange. Right? Orange. Just remember. We know here for index here it will be 1, 4 and 1, 5. Just remember, it's the first alphabet, it is the 1, and the pin index will be 1, 4 and 1, 5. And we know this oxygen, it has two O, so it will be 2, 5. Okay, fine. Whereas this Enternox, it will be having a separate pin index of 7. This nitrous oxide, it will be having, nitrous oxide and this oxygen, there will be content of air. They are the most abundant. They are the most abundant. So we'll just consider these two only for air. So this one, nitrous oxide, the suffix will be having 5, and nitrous oxide is N2O. So for this N2O, it is having this 2N and 1O, this 3, 5. Okay, fine. And it's how this cyclopropane, which is orange in color. And if you use this gray cylinder, which is used, means it's actually what? Which is the carbon dioxide one, which will be used in a case of laparoscopic surgeries, because our abdomen will be flat. So with this flat abdomen, if you enter and if you do surgery, there's a minimal space to do surgery. So what we'll do is we'll poke the abdomen, we'll just give some gases, especially the carbon dioxide, because it is cheap also and it is a flameless gas. So this carbon dioxide we use in a case of laparoscopic surgery. We'll use in a case of laparoscopic surgery. Fine. That's it for the day. Fine. As we told, we started at 6 p.m. around 6:10 p.m. and we have finished by 11 o'clock. Like it's exactly 11 o'clock. Fine. Just before going home, just have this thing in your mind. If you want to find about the road ahead, just find out, means just ask from them for coming. You are just coming back. So just if you want to pass the exam, or if you want to yes any exam in the world, okay, don't study randomly. Okay, don't study randomly, because it won't lead to a proper path. Whereas just see some previous year topics, previous year questions. There you know from where they are asking these questions. So if you know this thing from where they are asking, you know where to go, and you will go and you will reach the better and the best place ever in your life. Fine. That's it for the day. That's it for the day from my end. If you have any questions, you can wait for a while. We'll address your questions for next 2-3 minutes, and then that's it, guys. From my end, we'll meet up in the tomorrow session. Fine. See you. Until then, see you. Bye bye. Yeah. Thank you, Divya. Thank you for compliments, and thank you for staying active, and thank you for all other participants who are with us till this time, and thank you for others also. Like I just missed out few names, and thank you for staying active in the chat section. Fine, that's it for my end from today, and like one more final happy Doctor's Day. Okay, have a good time ahead. We'll see you tomorrow. Bye bye. Under